Hi, and welcome to day 2 of Mental Health America's 2020 annual conference. For those of you who are just joining us today, my name is Tom Starling. I'm the former board chair of Mental Health America and currently the CEO and president of MHA of the Mid-South here in Nashville. We are thrilled to have you all here with us today on day 2 of MHA's 2020 annual conference, COVID-19, mental health, and the need for equity. Our program today is really jam-packed with some incredible speakers who will be talking about what young people are doing to build resiliency in uncertain times, what teachers and parents are grappling with as many children are going back to school, how telemental health has been a critical option for therapy during this time, and finally, how racism and trauma have shaped the lives of so many Americans, and what we can all do today to help change that. But before I introduce our first panel, I'd like to take this opportunity to highlight a couple of MHA's 2020 award winners and hear from them directly on what it means for them to be honored. First, MHA's 2020 Mental Health Corporate Excellence Award. MHA bestows this award to an exemplary corporation that promotes the mental health of its employees, stakeholders, and the community. MHA looks at several criteria, including a company's commitment to its employees by offering programs, accommodations, and training that supports mental health and wellness in the workplace. A commitment to its community through contributions, education, job training, housing programs, public awareness campaigns, or other related activities. Has the company created and implemented policies and practices that destigmatize mental health concerns and ends discrimination against people with mental illnesses? And finally, can the company's mental health policies and practices be easily replicable in other corporate settings? This year's 2020 Mental Health Corporate Excellence Award goes to Verizon Media. Verizon Media is committed to shaping the way mental health is perceived and supported within its workforce and the global community it serves. The media company reaches more than 900 million people across the globe each month, connecting them with trusted news and content from its ecosystem of premium brands like Yahoo, TechCrunch, and HuffPost. With a focus on breaking down stigmas and normalizing mental health, Verizon Media implemented a comprehensive plan to address the emotional well-being of its workforce. Through partnerships with leading mental health organizations, they established best practices and implemented training programs centered on building a robust wellness program. And in the wake of COVID-19, the company expanded existing resources and developed new offerings to address unprecedented health crises. Let's look now at a brief video that Verizon Media has created this past Mental Health Month for its employees, just as an example of its commitment to their overall mental well-being.
The way I would define mental health is just kind of the clarity that you have in your mind.
Mental health is not dissimilar from physical health in that it is a product of your environment.
Psychological, emotional, social relationship. So to me, it's multifacets.
I didn't know it at the time, but I started to experience mental health issues probably in elementary school.
My younger sister, she suffers from anxiety disorder and OCD, and she just like completely lost control and she harmed herself physically.
I really didn't quite know about depression, but I knew my mother went through depression a couple of years when I was much younger.
I've had friends and family who've had issues with mental health, and some of them who've been open about it and taken care of themselves, and some of them, they've not ended well.
It took me a very long time, and I definitely sunk very far before I got to the point where I could seek help.
The biggest cultural stigma for a lot of people who don't share or they don't want to talk about this, society looks down.
People don't like to talk about that or really avoid even dealing with this issue head on.
那很多人不愿意承认自己有心理的问题，觉得这是一个很丢脸的事情。
I think the only thing we as humans that we can do here is to let this be open, let this be easy for people who are suffering with mental health to be able to open about and talk about it.
I think that once the discussion opens up, it won't seem as like foreign or strange to have mental health or seek help.
那当你有心理健康的时候，你不妨可以跟我们讨论。
Mental health sometimes is not something you can control, but having that awareness is so important. When you are on the verge of something that you feel you're not at the best of yourself, how do you stop and reflect what is really going on with you, and not to be afraid to share that with your close friends, family.
It's our responsibility to be able to make that stigma go away, for people to be able to talk about transparently so that we can do something about it.
We're all here for each other.
Accepting MHA's 2020 Mental Health Corporate Excellence Award on behalf of Verizon Media is its CEO, Guru Garapan.
Hi, I'm Guru Garapan, CEO of Verizon Media. I'm very humbled to accept this award on behalf of Verizon Media and in recognition of the work we've done to reduce the stigma of mental health and race awareness. Mental health has been personally important for me and a priority for Verizon Media well before the pandemic. I grew up in Asia where there was a lot more stigma around mental health. Unfortunately, the stigma still persists even today. Since I became CEO of Verizon Media in 2018, we began having important conversations to create more empathy, awareness, and understanding of mental health. We expanded our employee mental health programs and focused our efforts on the editorial content we were creating for the nearly 900 million people who turn to us for trusted content, like information, resources, support, and utilities. I know the focus of this conference is really on the relationship between COVID-19 and mental health, but the reality is that we were able to quickly step up for our employees during COVID because of the groundwork we had already established. And that is the key to any mental health initiative, program, or a plan. Consistency. We need to consistently speak about it, share our stories, listen to others, and provide support every day. And not just in times of crisis or when it is trending on social media. I'm very proud of the work we have done at Verizon Media to receive this recognition. To me, this award also represents a commitment, a contract really, about the future work we have yet to do. We owe our best efforts to this cause to all of our four stakeholders, our employees, our customers, our society, and our shareholders. And when we can all be our best, most supported selves, we all win. And I can't honestly do my job to the best of my ability without making mental health a priority. So thank you, Mental Health America, for the recognition, to our team at Verizon Media, who are great change makers and advocates for mental health.
Thanks so much, Guru, and congratulations to you and your team. And now, the George Goodman and Ruth P. Brudney Social Work Award. This award was established by the Board of Directors of MHA in November of 1986 to recognize a significant contribution made to the care and treatment of people with mental illnesses by practicing professionals in the field of social work. The award's establishment was actually made possible through a gift by George Brudney, a member of the MHA Board of Directors, in memory of his wife, Ruth, a psychiatric social worker. Nominees for this award must have shown that he or she has demonstrated a passion and dedication to the profession of social work in improving the care and treatment of people who have mental illnesses, and that they serve as an inspiration for their clients, patients, colleagues, and those pursuing the field of social work. This year's award goes to Julius Boatwright. Julius is a licensed master social worker who completed a trauma-informed community practice workshop with Duquesne University through their Department of Psychology and the Rita McGinley Clinic. He obtained his Master of Social Work degree with a certificate in Human Services Management from the University of Pittsburgh. Julius also earned a bachelor's degree in communication from Pitt. Mr. Boatwright completed a one-year professional development program for nonprofit executives with Leadership Pittsburgh and the California-based Rockwood Leadership Institute. Julius serves as the founder and chief executive officer with Still Smiling, an organization that bridges the gap between Black people and mental health supports through education, advocacy, and awareness. Their mental health workforce development programs, called Beams to Bridges, equips Black adults with knowledge, skills, and competencies needed to serve as community mental health workers. While completing the programmatic experience, these cohort members receive the weekly workforce stipends, emergency financial assistance, mental health training, behavioral health treatment, and social services support. Wow. Welcome Julius Boatwright, MHA's 2020 recipient of the George Goodman and Ruth P. Brudney Social Work Award.
Hello everyone, my name is Julius Boatwright and I have the privilege and honor of serving as the founder and chief executive officer with Still Smiling. Our mission is to bridge the gap between Black people and mental health support through three ways: education, advocacy, and awareness. Our 10-year vision is to connect every Black person in Allegheny County to at least one positive mental health experience that improves their quality of life by the year 2030. Our Black Mental Health Workforce Development Program, otherwise known as Beams to Bridges, equips children, youth, and adults with the skills and competencies they need to serve as trusted community mental health champions. While going through this program experience, they receive weekly workforce development stipends, emergency financial assistance, and access to funds that help offset costs related to mental health treatment. Now, in the midst of multiple crises, racial, economic, and public health, it is imperative that we pay very close attention to the mental health and wellness needs of Black people. So I am honored, grateful, and appreciative that Mental Health America is giving us an opportunity to convene and talk about this very critical and important subject matter at this moment in time. I always end by saying, somebody loves you, somebody values you, and somebody appreciates you. Please do whatever you need to tend to your own mental health needs and to provide some support and encouragement to every single person that you encounter. Please take care and enjoy the rest of the conference. Thank you.
Now, moving on in our agenda. In conjunction with Born This Way Foundation, our next panel is made up of youth advocates who will share with us perspectives on the best way to bridge the gap between available mental health resources and the young people who so desperately need them. Moderated by Kelly Davis, MHA's Director of Peer Advocacy, Support, and Services, we will hear from three incredible individuals who are working to improve health equity, break down stigmas associated with mental illnesses, and address systemic injustices around the nation. Kelly.
Thanks, Tom. Hi there, I'm Kelly Davis with MHA. I use she, her pronouns, and I'm really excited to be joined today by three awesome advocates who've been working with their communities and with Born This Way Foundation to make a difference in the lives of young people. So let's get to know each of our panelists. First up is Alyssa Lee. Alyssa is an intern for Born This Way Foundation, a reporter for the Center for Health Journalism, and a doctoral resident in occupational therapy at University of Southern California. Her goals in life include improving health equity, creating a kinder and braver world through the written word, and making the best Taiwanese beef noodle soup in Los Angeles. She holds an MA from USC and a BA from UC Berkeley. Next up is Cheyenne Kippenberger. Cheyenne is the current reigning Miss Indian World and is from Seminole Tribe of Florida. With her platform, Cheyenne is bringing awareness to the strength and resilience of Native American and Indigenous peoples, helping to destigmatize mental health, and working towards gaining quality representation in the media for Native American and Indigenous people globally. And we have finally Allison Kurtz. Allison has been challenged with multiple medical issues in her young life, including a life-threatening kidney disease. Despite that, she tried to live as a carefree adolescent, filling her days with reading, gaming, and surviving grade school. And yet every day she felt like she was living a life meant for someone else. Allison is transgender. Since transitioning, Allison has fought her way back from depression, anxiety, and suicidal ideation to pursue her dream of being just your average college co-ed. As a national ambassador for Children's Miracle Network and as a patient advisor for Cincinnati Children's Transgender Youth Clinic, she spends her free time advocating for more funding to support LGBTQ youth. So to get started, I wanted to open up a dialogue to learn more about each of you. So since I introduced you first, Alyssa, I'll start with you, and then we'll move through Allison and Cheyenne. Tell our audience a little bit about yourself and what led you to where you are today as an advocate.
Yeah, hi. So lovely to meet you all. My name is Alyssa. I use she, her pronouns. I really started my mental health advocacy journey through this platform that we started in college. So it was called 475 nanometers perceptions on mental health. It was a psychology class that we were taking. They asked us to do a 3% of our grade, like pay it forward project, where we would like make brochures or like speak to a class. And my friend and I decided that we wanted to create like a Humans of New York style platform for people to share their stories. We didn't want to go up to people and just ask, oh, like, what's your experience with mental health? And so we created this volunteer form, and kind of like how college students sometimes are, we did it very last minute, like the last week of finals. And we were surprised to get like 10 to 15 responses, like in a very short period of time. And then during winter break, we forgot to turn off the form, and 50 more stories popped up in our Google form. And we just realized like this was something that people needed to talk about. This was something that people resonated with. So we would go and interview the people for their stories, or they would share their stories via written word, and I would go and photograph them. And it was just really impactful to see like the amount of people, like I know a lot of people like that I looked up to, like were able to share their stories. And, you know, sometimes you feel like everyone has all their stuff together. But I think it was a really first like look into like, you know, I'm not alone. Everybody else is going through something as well. Since then, I'm in school to be an occupational therapist. And so going through my clinical rotations, I realized mental health is so relevant in every setting. And I did one rotation in community mental health where people with a lot of my patients would tell me, oh, I have this, I have that. And then they tell me their stories and what they've gone through to go there. And I don't know, just like being able to witness that and kind of understand people's resiliency has been really impactful. And so now I'm glad I get to be an advocate as a researcher, as a clinician, as a journalist, as a friend, a loved one, as a trauma survivor myself. Yeah.
Awesome. Thanks for sharing. I think, you know, the thing that came up repeatedly in your intro was really the power of representation and sharing stories. And I know, Cheyenne, in our intro, we talked about your work, particularly with representation and more stories and positive media coverage for Native American and Indigenous populations. So I was curious if you could share a little bit about your work in mental health and how that fits into your advocacy.
Well, I'm really excited to be here. I'm excited to meet everybody. And so in our traditional way, we always introduce ourselves in our native tongue. And so what I just said was hello to everybody. My English name is Cheyenne. My given name is Ite, which translates to fire in my own language. And I'm Seminole through and through. But I guess I could say my advocacy for mental health really began way before I was ever Miss Indian World. It kind of started with myself and realizing there's a lot of stigmatization in general about mental health and talking about it, but especially within the Native and Indigenous community, it's very, very stigmatized. And it was, you know, a tough journey, but I finally was able to kind of shed that burden of shame, you know, feeling just feeling any type of shame about it. And I speak very openly about my journey with my depression and anxiety and seeking out help, as well as, you know, having to be on antidepressants, which is, you know, not something that's really spoken about within my community. And so before I was Miss Indian World, I was representing my own tribe, specifically as Miss Florida Seminole. And I realized that there was a conversation that we really needed to start having. And I realized that as Miss Florida Seminole, I had not only a responsibility to serve as an ambassador and represent, but, you know, I needed to help, you know, push this forward, push this issue forward. And so through Miss Florida Seminole, I really found that I had a voice, and that, you know, speaking out can be impactful, and it helps to let other people know that they're not by themselves. And this is actually something that's very present, not only in our community, but all over. And going into Miss Indian World, it was something that I really wanted to prioritize, and, you know, breaking it down to just specific to my community itself. You know, we have a very different way of going about things emotionally and in that aspect. And so it was really important to me that I keep pushing that conversation. Let's keep normalizing these things. Let's, you know, make it a household conversation between parents and children, and how we can do that in a healthy way. And so, I mean, I'm very proud that I've been able to really take my own journey and share it, and, you know, just make that something that it's okay. It's okay to not be okay, and it's okay to talk about it, and it's okay to be upset, and there's nothing wrong with you. And so I love what I do. And because of this change of perspective and how it is that we can normalize these things, I mean, it's even gotten me to the point where I want to change what I'm going to school for, because I realize accounting may not be for me. But I'm really, really excited, and I can't wait to hear what everybody has to say today. Thank you.
Awesome. Thanks, Cheyenne. I know you mentioned the importance of lived experience at MHA. That's definitely something that's really important for us. MHA was founded by a man named Clifford Beers in 1909. He was diagnosed with what would be called bipolar disorder now, and had a lot of horrible experiences in the old mental hospitals of the time. So, you know, we totally share and believe that lived experience is so important in driving how we support people. And I want to turn to Allison to get to know a little bit more about you and your lived experience. I know you do a lot of advocacy around your experiences being transgender, so would love to hear kind of your story and how you got to where you are today.
Yeah, I'm Allison. I use she, her pronouns. And I honestly started activism specifically focused on transgender activism because it's such an issue right now, and because a constant theme I was seeing as I went to groups and talked to other trans people was how hard transition is, because of how you have to come out to people, and because of the toll it takes to be seen differently and to be separated into a sort of out group. And that's sort of when I learned that I can't just campaign for transgender acceptance. I have to campaign for mental health acceptance too, because these issues aren't separate issues as much as they are absolutely entwined. Because I've met an abundance of trans youth who just talk about mental illness as if it's a totally, we all have to deal with it, and that's never going to change, and nothing's going to get better. And it's a joke to them, because it's just how things are. And I kind of came to terms with how horrible that is on a concept, that we have to sort of make jokes of ourselves in order to make ourselves more palatable to people as a whole. And that's where I started talking about mental health and transgender awareness. I consider it a duty of mine to make sure that life for other people like me and other people not like me to have a much easier time going through their mental health journey, as I'll put it. than I did, because I have had a long history of issues with mental illness. I have been hospitalized. I have had a lot of run-ins with that. I've been in partial hospitalization and had to wait a long time through the system for lack of funding and space. And so I know just how desperately this needs to be spoken about and how desperately this needs to be normalized to the point where it's not a joke and is actually something we treat as important as like medical diseases. And thanks for the opportunity to be here. And also I am dying because I had to turn off my fan for better audio.
Thanks, Allison. It's awesome to learn more about you all. So we heard a little bit about your stories and how you've gotten here, but it's hard to ignore what's been happening over the last few months. It's been very intense for everybody in a multitude of ways. So I'm wondering to hear from all of you about how you're doing. And, you know, it's easy as advocates or as, you know, people who care about people to take care of others and to really put all of your energy into activism and advocacy, but also curious about how you all are taking care of yourself too.
Well, I'm taking my care of myself in the best way that I can, which is to say I have had to totally self-isolate because in addition to being trans and having issues with mental illness, my entire family is high risk. And I have kidney disease, a kidney disease, polycystic kidney disease. And so does everyone in my family except for my mother. So we are all high risk. If we caught the virus, then I don't feel like I need to say the outcome because I feel like we all know it. But, you know, I would die. And so I have had to forego the typical college experience for my sophomore year, along with my brother, my older brother, who's in his last year. I had to I had to cancel my dorm plans. I rented out a small house with my brother that has no heating or no cooling, which is super great. And so I have just been totally quarantining, and it's been rough, but it's also been survivable. And it's kind of a cop-out statement almost, it sounds like, because it is so regurgitated by every company on earth, but it's so amazing to see everyone getting through this, and it is amazing to see the tenacity of the human spirit as a lot of us come together and just try to stay together for being able to push through this. I personally have just been focusing on that aspect of it in order to get through.
I definitely feel you on that. It's definitely been tough. I've definitely had my ups and downs through all of this, whether we're talking about mental health, physical health, spiritual health, you know, it's all been affected. And it really just feels like all of our lives, you know, we're living in this, you know, normal bubble, and next thing you know, somebody just came and like ripped the rug out from under all of us. And so I know all of us have gone through some challenges with trying to, you know, navigate this really weird transition of, you know, not being outside, not being able to be around people, you know, our jobs are changing. And if anything, I think I'm really thankful for social media, and I'm thankful, you know, for FaceTime. And, you know, we always say it's a blessing and a curse, but this is the time that I really can sit here and say that it's been a blessing. And, you know, it's been hard. We've had to see our own family members and friends and relatives and everybody have to work through this, whether that be, you know, from home or actually out there working. And so, I mean, you know, as tough as it has been for myself, I really can't complain. I feel incredibly blessed, and I'm just thankful for being able to still connect with people, even if it is through my computer camera. And, you know, I take it one day at a time, and I've really, really been taking advantage of the fact that I still have access to my therapist as well. I've been really focused on trying to balance my health and my wellness, and so I'm really, really trying to make sure that I'm doing something physical every day, whether that's like sit-ups in my living room or, you know, something. But yeah, I do. I feel very, very blessed, and I'm just thankful that we're able to do, you know, even things like this.
Yeah, I resonate really deeply with what you both said. I really love this question. I feel like as people who are advocates and help people in the helping profession, we don't get asked this enough. Yeah, I feel this very similar to Cheyenne. I feel very lucky that I am able to work from home and I'm able to be here and tune in and talk to people such as you all and my friends and my family. It can be really hard, I think, to be so far away from everyone. I was really lucky this week to be able to come and help my sister move. And so I'm actually just like shunted to the very side of all the moving boxes right now in the corner. But really, really grateful and really blessed to have that opportunity to help her there. As an occupational therapist, I think a lot about like habits and routines and all the things like that our everyday lives allow us to have, like, you know, just walking to my car every day is like the exercise that I kind of built into my routine, and just trying to find ways to like regain some of that normalcy and like go for a walk in the morning before class, or like do a little walk from home in my living room. Yeah, like just to get ready for the day. Also, like, I think as you both have touched on, like the connection with other people and how to continue connecting with people through social media or through FaceTime, I think has been really important. During this time, I think I've also realized being on Zoom all day gives me a little bit of a headache. And so how do I build into like doing phone calls instead, even though a lot of my friends would prefer the video component. Yeah, so just, we're all here surviving. We're all here surviving together, and I'm proud of us.
Alyssa, on that note, the next question that I wanted to ask you all is, what would you say to people who are new to the world of mental health advocacy or who are just starting their personal mental health journey?
It's hard for me to sound like an expert, you know, imparting advice. I think everyone knows themselves best, and everyone is there, like, you're an expert on yourself, right? Like, you're the most expert on yourself than anyone else. And as you take things one step at a time and learn to listen to yourself more, I think sometimes you can be surprised to find new things about yourself. And some of these new discoveries are fun to find, and some of it really does give you hope for the future. My partner recently started therapy too, and I think one thing we've thought a lot about is like trying to keep yourself from comparing your journey to other people. The idea that like your path is your own path and it has its own logic and its own reasoning to it, and as long as you believe in it, you'll do great.
I really, really love that you touched on that, because I think when I first started my own journey, I was like, okay, like this is textbook how it's gonna go. Like, I got this, you know, there's like however many stages, and in reality, it is nothing like that. And, you know, just kind of how we've all mentioned before, there's like, even just through this quarantine, there's been ups and there's been downs. And now looking back at my own journey, which is still continuing, you know, because we're all going to keep, you know, continuing with this journey towards healing and towards wellness, it's never going to be like a straight path. And there's no wrong way to do it, and there's no textbook right way to do it either. And, you know, and I also love that before you mentioned that you're going to learn new things about yourself. And it really is like that, and it's still like that. And I even have to constantly remind myself that, you know, even being in a position where we are considered advocates of mental health, we still don't know it all. And we just try our best, and we try our best to share the information we know, and, you know, to spread education and to, you know, talk about our own journeys. But, you know, at the end of the day, behind closed doors, when we're going through these things by ourselves, it's not always pretty. And so I always kind of like have this joke with myself from like, just ugly, cry it out. Like, it's okay. And I think that kind of hits it right on the head, where it's like, it's not always going to be pretty, but it's also not always going to be ugly. And, you know, there's just no right way to do it, and it's going to be all right. And I encourage everybody to just continue towards moving forward towards your own healing, and just to remember that your path is going to be very different from your partner's path or your friend's path or even your own family members, but it's going to be all right. And, you know, at the end of the day, we're a community of people, and, we just have to be kind to each other, be loving to each other, but we also need to be kind and loving towards ourselves and give ourselves that same understanding.
Also, I love that so much. Every time I'm gonna start listening, I'm gonna hear you say ugly, cry it out.
My response, I feel bad because I continuously say this. I feel like I don't even need to be on panels anymore. They could just get a soundboard of me saying this, but it's my immediate response, both on a personal level and on a social level, is to talk about it. Talk about it, talk about it, talk about it. Because on a personal level, it will make you feel better to talk about it and help you get through your own understanding of what's going on. But on a social level, talking about the fact that you are going through this can cause, it's such a butterfly effect. It can cause such a change in the world around you, correcting people, talking to people about it, spreading the word. You are explosive. Everything you do has an effect. And I don't think enough people realize that and take that effect into their own hands. You have an opportunity to change the world with every action you make. And so for your own sake and for the sake of the world, talk about it.
I'm so jazzed, Allison. I'm so excited. I'm ready to go. So wanted to move into some individual questions for each of you. Allison, I'll stay on your note about talking about it and the importance of your work starting out in transgender advocacy and moving into more mental health and transgender advocacy. How have your experiences being transgender affected the way you navigate mental health care? But then also, and what inequalities have you seen specifically in your community that people might not know, particularly if they don't have that lived experience?
Well, the first thing that immediately comes to mind is how, mental health is in such weird position in the trans community, because on one hand, it is incredibly, incredibly important to be focused on, because being trans is a difficult thing and going through transition is a difficult thing. But on the other hand, there's something of a stigma to it sometimes for some trans people, because it has been weaponized against us in the past, with people telling us that what we are is a mental disorder and that we are wrong in the head. Go to therapy, not to get better for yourself, but for them to tell you that you were wrong. And so there's this sort of stigma around that I think is incredibly important, not only to dispel amongst trans people themselves, but also to dispel in the public eye as a whole. It's entirely different and yet the same, the way that we approach mental health. There's a different lens, but the same frame.
Thanks, Allison. So I wanted to ask a question of you, Cheyenne. Somewhat similarly, as a member of the Native community, what kind of inequities do you see that directly affect folks in your community? And then what can non-Native clinicians and members of mental health care community more broadly do to ensure that there's adequate resources available and also making things better as well?
I really, really appreciate this question because as Native, as American Indian, Alaska Native, or Indigenous, or just Native people, I feel that a lot of the time sometimes we just get left out of the conversation because there's such a lack of representation in practically all realms of our life. And, especially being Miss Indian World, one of my responsibilities is to represent all Native and Indigenous people globally. And so, just a little bit of pressure, but, just specific to my own community, we are very, very blessed in the sense that I have access to a Center for Behavioral Health literally right up the road from me. But that is not the scenario for many other communities all over the US. And so to try to sit here and really represent to the extent that my people, I feel like, deserve is difficult because there's over 500 federally recognized tribes. And of those over 500 federally recognized tribes, and that's not even including state or locally recognized, all the communities are different. And so I may be right smack in the middle of a very busy city, but sometimes there's communities that are 3-4 hours away from the nearest city. And so the largest disparities, I think, that are the easiest to talk about is just accessibility. Being able to have a mental health facility to go to, having resources, having funding, there's a large lack of those things within Native communities all across the U.S. And so, I think even, let's say we do tackle that and we start building these facilities all over, in and out of schools, on and off reservations, making them more accessible and, making it to where we even have those things available to the Native community. How do we provide culturally competent care while also, being able to provide these things? And so what's so important that non-Native clinicians and mental health professionals need to know, what's so important is that if you are going to be working with our community, there needs to be not only a historical understanding of our people, but also there needs to be a cultural understanding of our people. And it goes so much deeper than that, because I may be Seminole and we're from Florida, and our traditions, our language, our ceremonies, our clothing, regalia, everything is different from a tribe that's in North Dakota or a tribal nation that's in California. And so that historical and cultural understanding, it needs to go so much more deeper than just, the lens of what's American history. It's like, no, what is Mandan, Hidatsa, and Rickarot history? What is Bishop Paiute history? What is Choctaw history? What is Seminole history? And what are the cultural teachings and traditions of this specific tribal nation? And that is how we can provide the Native community the care that they deserve. And the fact of the matter is whether you're looking at the Native community, the Black community, no matter what group of people you're looking at, mental health care should not be a privilege. It should not be a privilege. That accessibility needs to be there for people, because everybody deserves this. Wellness and health is a human right that we have as people. And so we deserve to be healthy physically, mentally, spiritually. And so we need to have that access. We need to have these programs, these facilities. We need to have culturally competent care. But yes, like I said, I really appreciate this question, because it's just representation. I know we account for I think it's, if not 2%, less than 2% of the population. And so, just to give a little bit more context into that. But thank you.
Yeah, thanks, Cheyenne. I love everything you said. I think, we talk about supporting folks and providing more culturally competent care, but we also really need to be breaking down the structural and systemic barriers that prevent people from communities who are being talked about as needing culturally competent care from being providers or being, organizational leaders or being policymakers. So I think that there's a lot of local level work, but a lot of structural work too. I think part of that, Alyssa, Cheyenne, did you want to respond to that?
Oh, sorry. I was just going to say, absolutely, it's not just the local level, but it's really like going up through all the levels of everything. And it's really just taking that understanding that mental health care it should not be a privilege. It should be something that everybody should have access to. And so how do we start breaking down those barriers? And, by starting that, obviously, is having the conversation. And so this is why I appreciate even just being on this panel so much. And so, but thank you.
Yeah. And I think part of that too, this links to the question that I have for you, Alyssa, is part of being able to better understand different communities and communities that you aren't a part of is by having people with lived experience share their stories, and by having media representation of different groups of people and what it's like to experience their lives and their communities, and the ways that different things and different ways that mental health care specifically is structured that impacts them differently than maybe other folks. I want to ask Alyssa, in your work as an intern for Born This Way Foundation and a reporter, what stories do you feel like need more attention? And on top of that, what can other people who do have a platform do to help bring the voices of those who are not being highlighted to the front?
That's a really great question. I feel like I would say pass the mic and listen. I think, so I'm a reporter for Born This Way. I'm also a reporter for Center for Health Journalism. And every time I get assigned a topic or an issue, I think about who's in the room and who's in the story, and how do I intentionally bring who's not in the room or not in the story in. Yeah, I feel like it ties into, sorry, it's like my soapbox since I'm everywhere with this question. But I feel like telling people's stories is really sometimes can be and has historically has been changed in a lot of ways. You can see in our history textbooks how we tell the stories of the natives and how we tell the stories of transgender and how we tell the stories of everyone else who's not in the room. And so a lot of my work, I think, with Born This Way has been, how do we do it in partnership? How do we bring in people to tell the stories themselves? How do I check in with them and make sure this is something that they want to be on the record and something they want to talk about? And just being really intentional on that side. I think a lot of it is from my work as a clinician too, and thinking about like, how do we bring in culturally responsive care to communities? And number one is probably recruitment and retention of those communities to be healthcare providers in the first place. And how can we make that happen? Yeah, I sit on the diversity committee on our national board and also at our university. And a lot of what we discuss is the recruitment and retainment, but also how do we build in, how do we build it into the curriculum as well for the time being? And how do we bring in subject matter experts to come in and share their stories and pay them for their work to share their stories and share their expertise and leverage the cultural wealth that are in these communities to dismantle systemic racism and systemic health inequities.
So thank you all so much. I wanted to close out with one final question for everyone, and that is, what do you hope for your future advocacy work? Where do you hope your advocacy work goes from here? Or what gives you hope in the world of mental health?
I think being an advocate and being an Indigenous woman, my vision for, I guess, what I preach and what I share and everything is that one day mental health care won't be a privilege. And that if one day somebody wakes up and they say, I think I'm going to try therapy today, they won't have to jump through hoops to be able to do that. I hope that they'd be able to go to a facility, make a phone call, and it won't be something that is so difficult to be able to do for themselves, and they'll be able to get quality mental health care, where there aren't these inequities of cultural understanding or any type of misunderstanding at that. And so I really do believe, though, that with the work that everybody on this panel is doing, we're going to reach that goal one day, and we'll be able to see that. And I'm hopeful for that.
What gives me hope about where I want my advocacy to go is the fact that we are talking about this, that we are able to have a platform for it, and that people are willing to listen to it, and that we have such people that are at the forefront of our field willing to talk about this, and not only willing to talk about this, but being able to talk about this in a way that is so amazing and gets the point across perfectly. It has been a struggle to stay professional during this call, because during certain lines, like Alyssa, you talking about passing the mic, and Cheyenne, you talking about how it should be a privilege and not a right and not a privilege to have access to mental health. I had to fight so hard to not just pick up my bottle of antidepressants and start shaking it like a maraca. Everything here gives me so much hope for the future, that we have people. We are 3 people who are talking about this. There are millions of us who have the ability to talk like us and their own thoughts to say on the matter. And so this isn't stopping here, and it's not going anywhere anytime soon. We are going to keep on thriving, and that's all I could want for the advocacy that I do and the advocacy that everyone else does.
I think one of my favorite questions to ask is, what do you imagine, what is a world without stigma to you? And I feel like the way you both answered it, I don't know, I just felt like I saw the painting of what is to come in front of my eyes. I think what really inspires me is to be able to see Allison and Cheyenne, all of your advocacy and continuing to advocate for your communities and for everyone. I think just seeing the kindness in the world. So I started with Channel Kindness back in 2018, and Channel Kindness is really born out of the idea that a lot of the stories about young people tend to be negative, we're lazy, we're this, we're that. And a lot of the news media is negative and catastrophe after catastrophe happening, which is which is true. But being able to find the little things, like look for the people helping and look for the people advocating. I think this year I've also found that we're learning to be kind in a lot of different ways. And kindness isn't just I think there's a generic idea of what a random act of kindness might look like. But kindness can really be to yourself, to your family, to your community, to the world. My friend has this really great tattoo. It says, the real voyage of discovery consists not in seeking landscapes, but in having new eyes. And so I feel like the way we've expanded what kindness looks like is not just like a job title. There can be everyday things that you do that are intentionally kind. And we need to open up our eyes to see the kindness that is happening around us and all the opportunities for kindness as well.
I really, really appreciate this conversation, especially just because of all the different experiences and aspects and everything that we've been able to share and exchange. And I just want to say that I'm really honored to have been on this panel with all of you, and I'm super proud of you guys. And I know that we weren't able to come together in person, but like virtual love, you know. And I really do see great things coming for all of us and all of our communities. And I have a lot of hope for the world. And I think that, just being able to focus more on the kindness and the good stuff as opposed to everything else that goes wrong in the world is a lot harder to do. But I think we're up for the challenge. So
awesome. Well, I want to thank Alyssa, Cheyenne, and Allison for joining us today. And I also wanted to take time to thank our partner, Born This Way Foundation, for this panel. Born This Way Foundation is committed to supporting the wellness of young people and empowering them to create a kinder and braver world. So thank you all. And for folks watching, we will be right back.
Good morning, I'm John Boyd, CEO of Mental Health and Addiction Care Services at Sutter Health, and we've been proud to partner with Mental Health America over these last several years, and we're especially proud to be the 2020 presenting partner for Mental Health America's virtual conference. I want to start by thanking the team at Mental Health America for your hard work, for your innovation, and for your passion that brought this 2020 virtual conference to life during a very challenging time. We know that the challenges of 2020 had brought more attention to mental health, addiction, and suicide prevention services. We must now match that with sound policy and reform that leads to sustainable reimbursement and the spread of evidence-based practices, all focused on increasing access to mental health and addiction care for all of us. We know that mental health must be integrated with physical health, and at Sutter Health, we are committed to that. We refer to it as human health, a common ground that we all share, a common need that we must address, support within ourselves, within our communities, within our schools, and you all are essential to that. And you've been working on the front line now for years, providing those services. So for all of you on the front line, especially now, we at Sutter Health want to thank you.
I didn't know why my body was moving on its own. It turns out I have tardive dyskinesia, a condition that may be related to important medications I take for my bipolar disorder. Tardive dyskinesia can affect different parts of the body. It may also affect people who take medication for depression and schizophrenia.
In today's trying times, we're here to help you manage TD. Visit talkabouttd.com for a doctor discussion guide to prep for your next appointment in person, over the phone, or online.
It's a relief to know there are treatments for TD.
In these challenging times, mental health remains a high priority for ourselves and our loved ones.
Though we're not able to gather in person this year, we remain committed to supporting the mental health community.
At Synovian, we work each and every day to develop innovative therapies to improve the lives of those living with mental health conditions and their families.
We are here with you in your efforts to fight stigma and advocate for the community.
At Psych Hub, we're committed to educating and empowering communities to support one another through our mental health, substance use, and suicide prevention resources. Check out our evidence-based learning solutions and become a certified mental health ally at psychhub.com.
Wasn't that a great conversation with Michelle, my friend Tanitra? One of the biggest hurdles to clear during this pandemic, and this week especially, is the safe return to school. So let's talk about that for a bit. Kids, parents, teachers, principals, and school boards are all wrestling with the unprecedented challenges they're facing, as well as a lot of uncertainty about what's coming. MHA has been working with stakeholders in identifying the supports the educational community needs to make the return to school, whether in person or virtual, a mentally healthy one. It isn't easy for them because they're facing enormous stress and pressure to get this right. And part of the challenge is making sure they have the emotional supports in place that they need. You can find some of these on our website, mhanational.org, in our free downloadable back to school toolkit. Our next speaker, Leslie Boggs, represents one of our partners in the effort. As president of the National PTA, she has a broad perspective on what kids need. She's been working closely with parents and teachers across the country to make that happen. The PTA's mission is every child, one voice, and it's developed a powerful call to action for the federal resources needed to support all children and their parents, teachers, and support staff and administrators in their return to school. And here to talk about what the PTA has observed these past few months and what its 4 million members are urging now in response to the crises we face is PTA President Leslie Boggs.
Hello, everyone. Thank you to everyone at Mental Health America for having me here at your annual conference. I am here today on behalf of National PTA, the nation's oldest and largest child advocacy association, with over 22,000 congresses in all 50 states, DC, the U.S. Virgin Islands, Puerto Rico, and Department of Defense schools in Europe. That's right. Your child's school PTA, the one that planned the school carnival and fundraised to build the computer labs, is part of a nationwide network of families, educators, and community leaders dedicated to making every child's potential a reality.
I'm honored to serve as PTA's 56th National President. Here's something else you may not know. For over 120 years, National PTA has been a strong advocate and a reputable resource for millions of parents, teachers, grandparents, caregivers, foster parents, and other caring adults who share a commitment to improving the education, health, and safety of all children. We speak with one voice for every child in this country. Our association was founded on the belief that we can do more together than we can apart. And advocacy has helped us establish universal kindergarten, the National School Lunch Program, the juvenile justice system, and anti-child labor laws. I have seen firsthand how much we need each other in this time of crisis. The old saying, "It takes a village to raise a child," is still real for us. We all need some help every once in a while, and PTA is the village square, the gathering place where the magic of community happens. It's where we come together to solve problems, celebrate with one another, and plan for better days ahead. PTAs across the country are working hard to help school communities navigate the challenges that have arisen from the pandemic, focusing on social and emotional well-being, addressing food insecurity, creating resources for family engagement, demanding greater support for distance teaching and learning, and bridging the digital divide. Over the last few months, I have listened to hundreds of heartbreaking stories that had inspirational results. Thanks to the generosity of our sponsors and partners, National PTA has been able to establish a COVID-19 PTA Relief Fund and award over $1.27 million to PTAs across the country to help them better support their communities during this crisis. These communities have done some incredible things. And in my home state of Texas, one PTA established a food pantry and delivery service with the funding, knowing that many parents had lost their jobs during quarantine. During one delivery, one grateful mother whispered to a PTA volunteer, "I guess we won't have ketchup soup tonight. Thank you." As a mother myself, I can't imagine the emotional pain of not being able to provide for my child. I'm so grateful for the strong partnerships we have with parents, educators, and school leaders to help them solve the physical needs that this pandemic has created. But we must not neglect the severe mental health aspects of this crisis. Prior to the pandemic, PTA members were deeply concerned about the increasing number of children suffering from mental and emotional health and wellness conditions. And significantly, out of the 1,000 applications we received for these COVID relief grants, over 60% chose to specifically focus on mental health, demonstrating the strong need. Early detection and treatment of mental disorders is imperative for student success. Half of all students ages 14 and older who live with a mental illness drop out of high school, the highest dropout rate of any disability group. And these youth also experience higher suicide and incarceration rates. According to the National Alliance on Mental Illness, 20% of youth ages 13 through 18 live with a mental health condition, meaning that the odds are that in every classroom, in every school across this United States, there is at least one student with a mental health disorder. The situation has only been worsened by the pandemic. Children thrive on a sense of routine and stability. And of course, our normal routines have been severely disrupted. The stress of this moment is also compounded by the fact that the majority of young people who receive mental health treatment do so at school. And these usual diagnosis and treatment routines have been disrupted as well. I recently heard from one of our PTA members, Elisa Shook, who is a school counselor in Maryland. She told me, since the pandemic, the physical distance has taken its toll on many young people. Students are no longer really worried about whether they're accepted by their peers or if they will get a good grade on an assignment. Instead, students are wondering, will my parents die? Will I die? Are my friends okay? The burden of these questions and worries falls on parents, causing an immense amount of stress. Families are supportive, but struggling with their own worries and anxiety. This school counselor's fellow PTA members knew that they had to find some way to support their students, despite school closures. They decided to use grant funding from the National PTA COVID-19 Relief Fund to coordinate with counselors to establish a virtual mental health and social emotional support program that will enable parents and students to learn strategies and find resources. Unfortunately, we know that not every community is equipped to do this kind of work. Therefore, National PTA partnered with 5 other organizations to establish Shine Light on Depression, which is designed to create real and hopeful conversations around mental health. Through classroom programs, family workshops, and students clubs, we hope to ease the stigma of depression and increase access to mental health resources. National PTA is also doubling down on our programmatic commitment to mental health. We convened a working group this summer with over a dozen leaders in the mental health and school space. And coming out of that, we will be launching a brand new mental health webpage next month that connects families and PTA members with resources to better understand and take action to improve mental health. We will also provide training to PTA leaders on mental health because we know how important it is for school leaders to understand why mental health is so important, as well as what they can do to improve it in their own school communities. PTA also recognizes that COVID-19 has shown a bright light on the long-standing systematic health and social inequities among communities of color. CDC data shows that Black, Brown, American Indian, and Alaskan Native persons are at increased risk of getting COVID-19 or experiencing severe illness, regardless of age. Dealing with the effects of COVID-19 and the recent protest against racism has taken an immeasurable mental toll on families of color in our nation. As an association that represents all children and families, PTA believes it is therefore important and our duty to disrupt the systems that propagate institutional racism. That's why the National PTA Board of Directors recently passed a position statement addressing institutional racism to help guide PTAs across the country. It outlines how together we can be intentional, purposeful, and relentless in our efforts until every person enjoys the freedoms guaranteed to all Americans. First, we must listen. We encourage PTAs to have courageous conversations with their school communities to understand the impact of institutional racism and how it affects the well-being of children of color. This includes discussing related topics such as social justice, equitable education, juvenile justice, affordable housing, food sustainability, economic wealth, and affordable health care for families of color. Next, we must educate ourselves and our communities. It is important that we can identify the disparities that exist among students of color compared to their white peers to understand the resulting impact on school performance, academic achievement, and graduation rates for students of color. This means we must invest in educating students and teachers on the history and impact of institutional racism. We must also provide training for all school staff on implicit bias and culturally appropriate curriculum, as well as professional development offerings for mental health, trauma-informed care, and restorative justice to provide a safe, inclusive environment for all students. We can't do it alone, and that is why our position statement also calls for us to advocate for the change we need. We need to speak out with a loud collective voice at all levels to eradicate the negative impact of institutional racism. That means we must compel our federal and state policymakers, school district leaders, and school administrators to invest in the critical training needed. And these decision makers must also work with educators to review the curriculum, policies, practices, and programs to identify and address bias that perpetuate inequities toward children or communities of color that result in what we call the achievement gap or opportunity gap. PTA recognizes that action at the local level has a direct impact on our communities. Our school PTAs frequently speak up at school board and city council meetings, host letter writing campaigns to elected officials, and meet with their members of Congress. We are encouraging our local PTAs to focus their advocacy on issues such as disparate discipline, equitable education for immigrant children, recruitment and retention of Black and Brown teachers, housing development policies, access to health care, and juvenile and criminal justice. At the federal level, National PTA has called on Congress to provide additional resources to support students and their families, public schools, and the educators and staff that work in them. Specifically, we are demanding fiscal investment in 5 areas. The first one is emergency funding directly to states to support local education agencies. The next emergency COVID response must provide at least $175 billion in emergency funding directly to states to support K-12 education. Second is the support for federal categorical programs. With the devastation facing state and local economies, the student population will be significantly needier this fall. We've urged Congress to provide $13 billion for the IDEA and $12 billion for Title I, in addition to funding provided through the end of the fiscal year. Third is emergency funding for remote learning. This spring, schools and families found themselves in the never-before-found situation of widespread home-based learning. This fall, we must not repeat the long documented and persistent inequity as it relates to access to broadband. Congress must include $4 billion in funding for remote learning through the E-rate program. Fourth is family engagement in education. In addition to supporting students, many families have become and will continue to be their child's primary teachers in this virtual learning situation. National PTA has urged Congress to provide a one-time infusion of $245 million for the statewide Family Engagement Centers program to enable them to support the needs of families, children, and educators during this crisis. Last but not least is funding for school nutrition programs. Congress must continue to increase funds for food and nutrition services at USDA to prevent, prepare for, and respond to food insecurities, and to help schools adapt to new food service and meal protocols. You can add your voice to our federal advocacy efforts by sending a letter to your members of Congress through our PTA Takes Action portal on pta.org. This is how PTA is the village square of our school communities. We believe in protecting and nourishing the whole child and working together to help each child thrive in school and in life. That means supporting their physical and emotional health, as well as addressing environmental changes and challenges that make it difficult for them to learn and grow. We truly believe, as writer Margaret Wheatley once said, that there is no power for change greater than a community discovering what it cares about. All of you here in attendance today at Mental Health America's annual conference have discovered what you care about. You are a powerful force for change. Please know your efforts are deeply felt and deeply valued in so many communities across this great nation. I hope you will consider joining your local PTA or partnering with us so that we may amplify your efforts. Together, I know that we can make every child's potential a reality. Thank you so much for having me here.
Hey, everybody. My name is Teresa Nguyen, and I'm the Chief Program Officer at Mental Health America. So I oversee MHA's programs, including MHA screening, and I also oversee our research, which looks into how we use peers in the system, and also largely the use of technology to support people at the earliest stages of their recovery process, and certainly very interested in how we use large-scale data to provide insight into gaps for supports across our country. I am a licensed clinical social worker as part of my work and what I bring to MHA, and have spent the last 15 years just working as a clinician and an educator and an advocate. But today I am here with Dr. Neil Leibowitz, a psychiatrist and an attorney, and the Chief Medical Officer at Talkspace, which is a medical technology company that provides online therapy. Yeah. So in his role, he oversees the quality of care provided by therapists and psychiatrists on Talkspace, and he received his MD from New York Medical College and his JD from NYU School of Law. His bachelor's is in economics from Johns Hopkins, and you were previously a senior behavioral health medical director at United Healthcare and a faculty member at Albert Einstein School of Medicine. Is that right? Neil also teaches now health law at St. Francis College and is on the board of VIP Community Services, which is a large federally qualified healthcare center in the Bronx. Super cool. I love it.
Well, thank you for having me, and I hope I didn't intimidate you with a couple of letters at the end of my name. I know very little and just a little about a couple of the things. Hopefully I'll be able to share some of those with you today.
Awesome, definitely. And I mean, honestly, Neil and I have worked together. You asked me to come with you on a conference call, and we had so much fun. So I'm just glad to have you back in this capacity and have you share a little bit of what I've learned as part of your work with our community here today. Yeah?
I'm ready.
Let's dive in. Okay, so the first thing I'm just curious about is, I know a bit about Talkspace, but I'd love for our network to just hear what you feel like is the most interesting insight that you've gained since joining Talkspace.
Well, I'll tell you a little bit about what Talkspace does for those who don't know, and then something interesting that I definitely encountered. Talkspace is a mental health technology company. We provide therapy and psychiatry. Many ways it's traditional and video-based. Schedule a video with a therapist, pop on at the appropriate time and get care, or a psychiatrist. But the other way which we provide treatment is something called messaging therapy, where you choose your therapist, and instead of having a set video time, you're going to message your therapist, you're going to send them text, audio, or video throughout the day, and they're going to respond several times a week. So we've taken that 45-minute appointment and broken it into little bits, not necessarily in real time, where you're communicating really 5 days a week with your therapist. What's interesting about that, as a traditionally trained psychiatrist, as many of the clinicians in the audience are, when I first heard about this, I definitely hit the pause button and said, can this work? Is this for real? And as I learned about it, it became very interesting, and really about how people get their care is how they want to get their care. We've tried to solve for that notion that the most common number of sessions someone has in mental health is 1. And that's a problem that's plagued mental health really for decades. People come in and they leave, whether it's they didn't like their therapist or psychiatrist, whether it's they felt that they weren't mentally ill, maybe they didn't like their treatment plan. How do we solve for that? And the part that was most interesting to me was that people on the consumer side, so people seeking care, actually wanted this long before the research community, the payers, employers really caught up with the notion that this is something that can really help people. There were thousands of people at the time who said, hey, I want to try this. I want to get my mental health this way. And many of them stuck, and not just for one session, but some of them at this point have been getting care from a therapist in a way for several years. And that was really amazing to me.
It's totally true. Because of COVID, I've had to start all my therapy sessions online. And there are a lot of things that I've heard just like from my friends who are also in therapy that we can get kind of stuck in these moments where I either like seeing myself on camera and that's fine, or some people have been like, I hate the fact that I can also see myself and now I feel utterly anxious about the fact that I'm also staring at my face. I will just say personally, I've really enjoyed that I can just show up, and because I've been in therapy forever, I'm just like, whatever. I've eaten a meal with my therapist and she's like, okay, this is a first. I'm watching you eat a chicken leg. And I'm just like, dude, I'm going to be so hangry if I just don't. So this is the best use of technology and being able to show up. Right. But in terms of, you're a psychiatrist in your training. So as someone who is the provider on the other side, who also works with the technology, what's your advice on the flip side about the ways that we as users or as a client, like I'm a client, right? How do I prepare myself to get the most out of using a platform like Talkspace to reach a therapist online?
So first, don't have your session while driving. True story. Okay. So number one is really go into it with some sense of, this is how I'm going to get my care and I'm going to do it safely. But aside from that, it's really about having an open mind into what treatment is and how is it best going to work for me. And for many years, decades, we focused on treatment in terms of this is how we offer treatment to people. And there's been a more shift of that balance. So for some people, it's going to be face-to-face. And I think that that's great. And then we're going to return to face-to-face. And for some people, it's going to be flipping on the video screen at a set time. For other people, it's going to be this asynchronous modality where I'm sending messages to my therapist throughout the week and I'm not going to do appointment-based. For others, if we expand the box, it's going to be I work with Calm and I use that app, or maybe I use it in conjunction with my therapy. And giving people a choice within a range of what people need, right? Someone who's obviously having thoughts of harming themselves, giving them Calm is not going to be appropriate. But within a range of most people, it's finding what works for you and your own balance, and then finding the right person. And one of the interesting things that we've found is that opening up the telehealth world allows someone to find a therapist who's a fit for them. If you live in Alaska and you're looking for a therapist that is Muslim, it's going to be pretty hard, especially if you live in a small town in Alaska. Maybe in the state, there's now the option. Maybe as under COVID, there's been emergency licensure, and we've broken some of those barriers, and maybe we'll get to talk about that a little later. And now you have the ability to find someone, A, with an expertise in what you need, whether it's military issues or trauma, or a type of therapy that maybe you think can help you or works well for you, or just really a granular fit and a match with someone who can identify with you and you can bond with at a level that you really haven't in the past.
That is so true. I do often find that one of the most challenging parts of finding a therapist or doing therapy is finding a therapist. And sometimes we feel like it should just happen, and when things don't click, then you just feel really bad, and this is why we stop therapy. So the fact that Talkspace offers kind of a marketplace for you to test things out is a really interesting concept, that I think that in the world of telehealth is going to shape the way that people think about how to initiate care. That's super cool. So I think there will be a lot more to see and to come as we grow this experience for users, right? You touched on an issue around, that technology gives us the option to find a therapist who doesn't live in our state. But I know from our advocacy work or policy work that that's a challenge, like cross-state care. is an issue, I'd love to kind of turn our attention to that direction and just hear more about what you see in Talkspace in terms of an advocacy or a policy change. What changes in policy have you seen during COVID, maybe, that have the biggest impact on access to care?
The bane of my existence is a giant spreadsheet that has regulations for all 50 states for psychiatrists, nurse practitioners, psychologists, social workers, mental health clinicians, marriage and family therapists, and on, each broken up by state and sometimes broken up by over 18, over 13. So that's the regulatory landscape we live in. And in a way, it hasn't caught up with telehealth. So I live in New York. In my bricks and mortar practice, someone who works in New Jersey can come see me. In the telehealth world, if they live in New Jersey, they cannot see me on screen. Okay? My license has to match up with their state of residence. So it made a lot of sense back in the day where state medical boards really needed to protect people in their state. You didn't want that doctor from Texas who had 15 botched surgeries coming to New York and now being able to operate on you, or that therapist who is providing poor care doing the same thing. In today's world, we've broken down the barriers through technology, and we've seen this with COVID, with allowing for cross-state practice. And we've used this in Talkspace, and I've used this in my practice a bit as well. And at the end of the day, from what I've seen and the data that I have, and also talking with some of our congressional representatives in their offices, we haven't seen this implosion, people getting really bad care, malpractice coming up. So we have this complex regulatory web, and it's really turned into an impediment. And going back to that Alaska person, they can't find a therapist in New York or Washington or California, where there are thousands and thousands of therapists with every specialty, with a better demographic in terms of minority therapists. So if they're looking for someone who is that Muslim therapist, that may not exist in their realm or easily findable in Alaska, but it is in California, and it is in New York and many other states. So that's sort of regulatory piece number one. And then regular piece number two is a lot of the rules surrounding who can even have telehealth. So Medicare and Medicaid were both, I would say, behind and did not have an expansive telehealth policy. So people who had Medicare may or may not have been able to get their care via telehealth. Medicaid was also not as strong. In some states, it wasn't accessible. And we've brought down many of those regulatory barriers. And right now, where we're at is access to care is enormous. And the patients, the clients love it. And the truth is almost every provider who I've spoken to, be it therapist, psychiatrist, physician in all fields, have loved it and want to incorporate it, maybe not 100% of their practice, but want to keep this as part of their practice.
Yeah, that's really so true. I think of a lot of the missed appointments that I might have had because something came up in my life, and then I have to calculate the fact that I have to drive to my therapist's office as a factor for ending up canceling an appointment. But it would be so different if I could call or just get on to a camera and just start and initiate therapy in that one moment. It would probably save on a lot of missed sessions, right? But you've discussed a couple of changes, and I know that we've had a lot of policy changes related to telehealth since COVID. If you had to pinpoint into one particular change that we've seen recently that probably needs to stick, what would you say is the one policy change that needs to stay?
I mean, to me, it's really a no-brainer. It's allowing across the United States people with U.S. licenses to practice across the United States. At the end of the day, my medical degree is my medical degree and my specialty is my specialty. It doesn't change if I have a California license or a New Jersey license. So there's no real training differences. The doctor you get with those licenses is the doctor with those same skills. So finding a way to allow for broader access to people in rural communities, people in states that have real shortages, to me is a huge value proposition. It's a win for clients, it's a win for physicians, it's a win for therapists. All around, everyone wins. And yes, there are some things we probably want to put in place before we do that. We want to make sure we have proper monitoring, that maybe there is reporting, so we keep some of those state rules and regs in place and make sure people are following them. But I think it's really imperative that we work towards finding the right way to do this safely, ethically, and relatively quickly.
Yeah. It seems like dismantling 51 states plus territories on destroying their state regulations would feel very hard, but I don't know why it wouldn't be totally feasible to create a national registry of providers who want to enter some kind of federal process for then providing cross-state treatment, especially around telehealth. So there must be a will to make this happen.
Interestingly, there is something called Interstate Compact for Medicine, where some states have agreed to accept licenses from other states. It's expanding. It's getting there. I can't tell you exactly how many states, but it's probably high teens at this point, maybe even over 20. And there is movement. What's interesting is I am not aware of that similar movement for any of the licensures that we spoke about earlier in the therapy arena. So in a way, medicine, physician, not tooting my own horn here, but medicine is a little more advanced here and has realized the value. Not all states, and there's a lot more work to be done. But the therapy community, and it's probably in part because there are so many different licensures and groups involved, is actually behind. And when you think about what's a more natural fit for video-based care, for telehealth, it would be mental health, because it's really the one specialty where you don't have to touch the patient. You don't have to have a stethoscope. You don't need an EKG as part of your routine care. So it would really lend itself. So it's a little disappointing that you know, us as mental health practitioners are actually a little bit behind the 8 ball rather than at the forefront.
Dude, you're so right. It's true. And if we can't come together to make this happen now, we probably definitely should. So, you know, outside of COVID, we've been wrestling for the last 400 years with understanding race equity issues. You touched on the needs of Muslim community members looking for treatment. Have you seen things change? Are we better at serving people who are currently underserved populations? What's your sense of where we need to grow or what's happening in the space? There's a lot of questions I just asked you, so you can basically share whatever you want.
I'll pick and choose. We're better, but we're nowhere near where we want to be. We've spent a lot of time looking at our network and our makeup of really race and gender. And ultimately, there's not enough work being done at the educational level, meaning that I believe the statistics are something akin to 20% of the therapists represent minority, and that's all minorities inclusive. And the demand is higher than the supply there. And there's a large to male ratio. So again, there's more demand for male therapists, primarily by men, than there are supply. So first is we have a lot of work to do from really an educational standpoint and driving people into these fields, making it available, accessible, affordable for them to enter. So we really can have that cultural competency as an industry. We're focusing on building out our network, but we're working with limited supply. So any therapist who joins our network and says, I can see 20 clients or 20 less clients they're seeing elsewhere, because it is limited. So I think that's A. B is I think that there's a lot of work and training to do really to work on people's cultural competencies. It's an area I've tried to work on as well, and I definitely want to do more work, because it's not always about if I am Black, I need a Black therapist. I need someone who can understand and help me, and maybe help me with my depression. So having a broader sense of cultural competence across the entire community of therapists, I think, is very valuable. And we focused on both increasing our network and also increasing the training that we offer to the therapists in the network surrounding these groups and issues to try to really offer more expertise and, really a broader product of therapy and psychiatry. But there's a lot more work to do, both for us and really for the entire community.
Yeah. If you had to think about where your largest gaps are in terms of providers, what are some of the qualities that you find are the hardest or the biggest gaps that you need in terms of a provider network?
That's a great question. Increasingly, the transgender world, because the number of therapists is very minute, there are some people with expertise there, but as you start to move past this notion that sexuality was either gay, straight, and moving into a broader definition, recruiting there has become important, and the community hasn't caught up in terms of numbers, so that's definitely a focus. And really, broad-based minority, but the hardest part for us, honestly, is in a lot of those states that traditionally don't have large minority communities, but those communities exist, finding enough therapists to serve the demand. So whether it's Alaska, whether it's Hawaii, whether it's Idaho, I'm not picking on specific states, it tends to be really hard to build out that network. So to the extent that it goes back a little to what we spoke about previously, is if I'm able to tear down the walls and allow my New York and California, where I feel like we do a pretty good job with supply and demand, to cross into the places where we're just struggling from a bandwidth and our network is a little more bland or doesn't offer the breadth that I wish it did.
Mm-hmm. It's so true. And you say transgender community, and right off the bat, all of the data that we have from our MHA screening program screams that our transgender community has an immense amount of need. And it's really not surprising to me that that was one of the first populations that popped up to you as the hardest then to fill in terms of that gap in care. So we're coming to the tail end of our time together. I'm so sad. I think we should close out with last thoughts on how people can get connected to you, because we have a network of people who need treatment, but also providers and advocates. So how should we get connected to Talkspace?
Easiest way, Talkspace.com on the web. But more importantly, I want to speak broadly. We do a lot of work in the content arena, education arena, whether it's Instagram, Facebook, all those social media things, which I kind of missed the revolution on. I think I have a LinkedIn account. That's about it. But on all those things, we're active, and there's a lot of material that really you can learn about mental health, learn about issues, get involved, advocate. So all those things sort of are in our ecosystem. If you need care, of course, we're there. If you provide care, of course, we'd love to have you. But really, from a broader sense, I look at it as one of our missions and goals is to provide education and support to people. Not everyone who needs to see a licensed professional. It's really for everyone and people who just want to learn more about some of the issues that they may be dealing with, family, friends, loved ones, and especially in a time like this where anxiety is at an all-time high and mental health needs are an all-time high. It might be a great time to really educate yourself.
Totally. Thank you so much, Neil, and taking the time to speak with us today. Thank you, everybody online, for watching. And I think what we're going to do is be back in a few minutes with more programming.
We started off 2020 thinking it would be a typical year. Instead, it's turned out to be anything but normal. A lot has happened outside of our control, yet we're not powerless. This November, the mental health community has a unique opportunity to make our voices heard. Here's how you can take action. Register to vote, and if you've already done that, double check your registration status just to be sure. Request a mail-in ballot today and return it as soon as possible. Pledge to help 5 people register to vote by texting "We Vote" to 345-345. Learn where candidates stand on mental health issues at mentalhealthforus.net. Finally, fill out the census to help ensure that political representation and federal funding reflect your community's needs. Together, we can improve our mental health care system and make a difference. Thank you and happy voting.
Hi, I'm Valerie Stearns, Vice President of Affiliate Services at Mental Health America. I oversee affiliate recruitment and retention and provide technical assistance to MHA's 200 local and state affiliates. To be a part of the MHA affiliate network is to be a part of a national network of like-minded individuals with diverse backgrounds, experiences, and perspectives. The best part is camaraderie, sharing of best and promising practices, and interacting with colleagues throughout the country. Want to know more about the MHA Affiliate Network and how you can become involved? Email me at vstearns@mhanational.org.
Senator Bill Cassidy here, speaking to you regarding mental health in the time of COVID. I chuckle. Right now I'm quarantined. And so I actually have a sense of the isolation one feels when one is away from people whom you love because of coronavirus. But coronavirus is not unique. Coronavirus merely highlights that which we all know is to be the case. We continue to have a greater need to address issues regarding regarding mental health in our nation, and coronavirus just accentuates that. I come from this, as we all do, knowing family members or loved ones or close friends who've had mental illness, perhaps a little bit more. For over 20 years, I worked in the Louisiana public hospital system, and before that in the California public hospital system, and just saw firsthand the relationship between mental illness and homelessness, addiction, the inability to take medications, the impact upon individuals, the impact upon families. I could go on, we could all go on. We know that this is a human tragedy, but it doesn't have to be. If we can intervene, we can make it better. But more about that later. Now, I repeat that all this pre-exists, but COVID just highlights. And whether it is the social isolation, the loss of a job, being on the front lines as a healthcare provider, COVID merely accentuates that which is underlying. Indeed, someone said to me, you know, there's those who are more fortunate and those who are less fortunate in coronavirus. I suspected they were talking about maybe money. I changed the subject, pivoted. Yes, if you're isolated, it's a tougher time. But if you are with family, no matter what your other circumstances, if you're surrounded by loved ones, then you have that support and that stability. I do think this is a time in which it is the isolation and the anxiety which is exacerbating underlying tendencies to having issues of mental health issues. Now that said, we are seeing some positive things come from this. In the effort to expand healthcare provision when people cannot come together, CMS has expanded telehealth opportunities, including mental health opportunities. And that's really good. And that's one of the things we hope will continue after the crisis resolves. But that said, there is more to do. First, I had the privilege of working with Senator Chris Murphy in 2016, Congressman Tim Murphy, and then Congresswoman Johnson from Dallas-Fort Worth area on the mental health bill of 2016. It was called the most significant reform of of mental health in 30 years. I mention it now because we must continue to implement this program to see exactly how it works, what needs to be tweaked. And so as you see this implemented, give feedback to let us know, again, just how well it is going. But on the other hand, we have more to do. So I've introduced with my colleagues the Dr. Lorna Breen Healthcare Provider Protection Act to support mental health services among my fellow healthcare providers. We have heard of suicides associated with people caring for COVID patients, the constant stress, the inadequacy of resources, and yet having to care for people in which resources are in great demand. We need to support our frontline providers as they care for those and do just God's work as healthcare professionals. Now, I would like to continue to make permanent the telemental health and other telehealth services that have been put forward by CMS as temporary rules in the setting of coronavirus. Veterans continue to have issues of suicide and others. We just passed a bill in early August that expands mental health services and attempts to address suicide among veterans. One amendment that I had would ask that the Department of Defense and the VA jointly investigate suicides that occur within 6 months of separation from DOD. Is there a way there could be a warm handoff between Department of Defense and the Veterans Administration for someone who might be, from however is to be determined, thought to be at increased risk for mental health issues when he or she separates from DOD? I think this has a lot of promise, and have met with veterans VA officials since, and they have already some ideas how to implement. And so I'm hoping that this can help address that spike in veteran suicide we see within the 6 months of separation from service. And lastly, the Mental Health Parity Compliance Act, which was included in the lowering the healthcare cost bill. We just need to get this across. There's been an effort to have mental health parity since before I was in Congress. We need to continue that effort so that when somebody has their physical health addressed, we can simultaneously address mental health. As we know, having poor mental health is a major predictor of early death from physical health complications. The only way to address it is to address it simultaneously. Now, where do we go from here? We have to have a partnership. We have to have the partnership where you as providers work with public policy folks, legislators, the executive branch, whatever level of government we're speaking of, federal, state, or local, to implement these policies and to change and evolve as our society evolves. I thank you for the feedback that you've given to us. Our amendment, again, asking for this warm handoff between Department of Defense and the Veterans Administration, came from knowledge folks such as you shared with us that the peak suicide rate among veterans was in that 6 months just after separation from DOD. The more we have real-time, actionable information from what is going on, whether it is in coronavirus or whether it is in part of the Veterans Administration or whether it is just the underlying issues, the more Congress can respond. So I thank you for the partnership. I thank you for your good work, and I look forward to working with you on these important issues going forward. Thank you.
My name is Edward Schmidt. I'm the co-founder of I Don't Mind and the director of the I Don't Mind program at Mental Health America. I Don't Mind is a mental health awareness campaign and lifestyle brand, and our mission is really simple. It's to inspire open and honest conversations about mental health in new and creative ways. I don't mind is the start of a sentence that leads to a bigger conversation about mental health, like I don't mind going to therapy, or I don't mind asking for help when I need it, or for me, I don't mind talking about my anxiety. And you can get involved with I Don't Mind in a lot of different ways. Here's a few. Shop I Don't Mind, wear it out in the world, and let it inspire conversations about mental health with your friends and your family. You can read our mental health articles that we publish weekly on our I Don't Mind journal. And you can follow us on Instagram for updates and to join a community of like-minded people who are just as passionate about mental health as you. Visit us at idon'tmind.com to learn more.
Welcome to our 2020 Media Awards. You won't want to miss the award recipients or videos you'll be seeing during this segment. These are always amazing, and there's always a surprise or two as well. Every year, MHA recognizes journalists, authors, digital platforms, media outlets, television shows, and filmmakers who have tackled the issues of mental illness and addiction, and in doing so have educated and informed us all. This year's MHA 2020 Media Award recipients include 6 outstanding and diverse examples across multiple platforms. First up, Sesame Workshop. As many of you know, Sesame Workshop is the nonprofit educational organization behind Sesame Street, the pioneering television show that has been reaching and teaching children since 1969. Today, Sesame Workshop is an innovative force for change, with a mission to help kids everywhere grow smarter, stronger, and kinder. Sesame is present in more than 150 countries, providing almost 200 million children with access to life-changing early education, critical health lessons, and helpful tools to build resilience from tough situations. Their Social Impacts Division educates people about a host of issues that impact children's mental health, including traumatic experiences, autism, gender equality, and helping military children and families thrive when parents are deployed. Their initiative, Sesame Street and Communities, is an example of the significant impact Sesame is having with children and families around the country. Let's take a look.
Young children are full of potential, but adversity can stifle that potential. Too many children struggle with poverty, poor nutrition and health, and even tougher issues like the incarceration of a parent. All of these can contribute to stress in kids that can be obstacles to healthy development. But we can help if we intervene early. With the right support from caring adults, children can overcome many of life's challenges, big and small.
We see the gamut in terms of really hard things that could happen to young children. But what we know is that if it's shareable, it's bearable, and we can learn to put words to it and start to make sense of it, it loses its power over us.
We launched Sesame Street and Communities to empower parents and on-the-ground partners with materials, support, and years of Sesame Street experience that can give children a healthy foundational start.
We knew that if we had our community connections coupled with the trust that the brand that Sesame Street has and the experience they have bringing high-quality early childhood education, health, wellness programming to kids and their families, that we could really make a positive impact.
Sesame Street and Communities can make sure kids are prepared for school, encourage them to stay healthy,
What did you have for breakfast this morning?
and critically important these days, learn how to bounce back from traumatic experiences.
Big Bird, you know what I like to do to feel calm? I go to my safe place. Your safe place? That's right. It is a place in my imagination where I...
Social emotional education and learning is really important, and that's something that I don't think we're doing enough of. And having Sesame Street and all of these amazing tools and resources that can only enhance the conversation that we're currently having is just kind of a perfect match in my mind.
Sesame Street has always taken on tough issues facing children.
My parents are divorced.
Using Sesame Street materials and characters help communicate, and already having that language that the child knows makes our job so much easier.
And now, with the help of our partners, we're bringing our lessons directly into the hands of children and families who need them most.
When do you get to see your mom?
Not that much.
How come?
Because she's in prison.
Oh, she is?
Yeah.
It must be really hard.
Using Muppets to tell the story allows them to not feel alone in their experience. It shows them that other people and characters have felt the same things that they're feeling. Children can grow from their experiences and out of their experiences into wonderful people.
Whether it's helping children overcome difficult circumstances or simply helping parents with the routines of the day, we're bringing Sesame Street to every street, giving all children a chance to thrive.
Accepting MHA's 2020 Media Award on behalf of Sesame Workshop is Jeanette Betancourt, Senior Vice President for its U.S. Social Impact Division.
Thank you so much, Paul, and Mental Health America. We are so grateful and honored by this award. To receive the 2020 Mental Health America Media Award is both a privilege and an honor, primarily because we share the same mission. The mission is that together we're bringing awareness around what it is to bring mental health and to understand mental illness across our nation. We know that to prevent mental illness, we have to start early. And those fundamental factors of increasing awareness on social emotional learning for young children, and also to support the adults around them to create nurturing connections, and more importantly, to also know that there is no stigma around mental health illness. You had the pleasure before I came on to see our reel around Sesame Street and Communities. Sesame Workshop is a nonprofit organization whose mission is to help children around the world become smarter, stronger, and kinder. And through every move and every action that we take, we believe that we must bring children's perspectives into mind and improve their well-being. And the best way that we do that is through partnerships like Mental Health America and others who are committed to understanding what well-being means. It is an honor and a pleasure to be together and committed to our children's well-being and to parents and caregivers. When we do this work, we understand a couple of things. One, that in order to do so, we need to understand what social emotional learning is for young children. How do we support their growth and nurturing connections? Second, we also need to understand what trauma is and traumatic experiences. And through all of our resources on sesamestreetandcommunities.org, our goal is to create a circle of care. Whether that circle of care is important adults addressing trauma or our most recent focus on a health emergency due to a pandemic, or to deal with parental addiction or even suicide. In all of those instances, we have shared an approach and we shared a commitment. To drive change, we must bring awareness to start early and nurture our young children's well-being. So together, by this award, it really symbolizes our continued commitment and our grateful nature in partnering with Mental Health America to continue our work together. We are grateful, we are honored, and I leave you with the fact that as you walk away, please use our resources on sesamestreetandcommunities.org to continue our mission together. Thank you.
Next up, Hannah Dreyer for print journalism with the Washington Post. Hannah Dreyer is a Wesleyan-educated journalist who won the 2019 Pulitzer Prize for feature writing. She is being honored today by MHA for revealing the trauma faced by young immigrants held in detention as they arrive in America, and the astonishing and inhumane reaction to that trauma by the United States government. She reported on the experience of Kevin Uceda, a teenager who confided in a therapist at a migrant child shelter and now faces deportation as a result. The piece made the trauma of one young migrant real to readers across the country, and was one of the most read in the Washington Post for days, with more than 1 million readers. The story was the first to explore the kind of therapy migrant children are given in detention. It also broke news about how those therapy notes are used and misused. Hannah's work revealed that the United States government was requiring detained migrant children to attend therapy and then sharing the things they told therapists with ICE to be used against them in court. The reporting had instant impact, with legislation introduced in the U.S. Senate and House of Representatives, an internal federal audit, and policy changes in migrant child therapy rooms around the country. We are so grateful to Hannah and for she and the Washington Post shining a light on this issue. Let's hear directly from Hannah as she reads aloud a few paragraphs from her story.
It was time for another hearing in the ongoing U.S. efforts to deport a Honduran teenager named Kevin Uceda, who had already been in detention for more than 2 years. In a Northern Virginia courtroom, U.S. Immigration Judge Helen Perlman peered at a TV screen as a detainee came into blurry view. A slight 19-year-old with deep dimples and a V-shaped scar on his forehead. "Buenos dias," Kevin said, hoping this was the day he would find out about his request for asylum, and then tried to follow along as Perlman began to explain the latest twist. Kevin was watching from a remote detention center. On one side of the judge, he could see his lawyers, ready to argue that he should be freed immediately. Across from them was a lawyer for the Immigration and Customs Enforcement Service, there to argue that Kevin should be deported. And in front of them all, inside a thick folder, was an old report from a shelter for immigrant children that was the reason for the long-running matter of Kevin Uceda. Quote, youth reports history of physical abuse, neglect, and gang affiliation in country of origin. Unaccompanied child self-disclosed selling drugs. Unaccompanied child reports being part of witnessing, torturing, and killing, including dismemberment of body parts, the report said. The person who had signed it, a therapist at a government shelter for immigrant children, who had assured Kevin that their sessions would be confidential. Instead, the words Kevin spoke had traveled from the shelter to one federal agency and then another, followed him through 3 detention centers, had been cited in multiple ICE filings arguing for his detention and deportation, and now, in the fall of 2019, were about to be used against him once again. This kind of information sharing was part of the Trump administration's strategy that is technically legal, but professional therapy associations say is a profound violation of patient confidentiality. To bolster its policy of stepped-up enforcement, the administration is requiring that notes taken during mandatory therapy sessions with immigrant children be passed on to ICE, which can then use these reports against minors in court. Intimate confessions, early traumas, half-remembered nightmares, all have been turned into prosecutorial weapons, often without the consent of the therapists involved, and always without the consent of the minors themselves, in hearings where the stakes can be life and death.
Thank you so much to Mental Health America for this honor. This story revealed for the first time that the Trump administration was requiring detained migrant children to attend therapy sessions, and then using information the young migrants confided in therapists to argue for their deportation in court. My reporting focused on the case of Kevin Uceda, an orphan who fled violence in Honduras. Kevin trusted in a therapist in Texas, only to have ICE take his words and use them against him in court for years to argue for his deportation. This piece had an immediate impact and led to the end of this practice of breaching young people's right to confidentiality. I am so grateful to the dozens of shelter therapists I spoke with for taking real risks to help me get this story out. I'm grateful to the Post for helping make sure the story was told in the way it needed to be told, and of course to Kevin for taking the biggest risks of all and trusting me with his story. And thank you to Mental Health America for highlighting and encouraging this kind of complex, time-consuming reporting on some of the most vulnerable people in this country. Thank you.
Next up, KXAN TV in Austin, Texas, my old hometown. KXAN knew that Texas health experts estimated that 1 in 6 students is significantly affected by mental illness. Many drop out of school, wind through the juvenile justice system, and even end their own lives. Away from home, schools are often where these mental health concerns arise. As state leaders aim to tackle this critical campus safety issue, KXAN decided to explore potential solutions across Texas and beyond by creating the Save Our Students initiative. The station created a multi-page digital project featuring more than 40 stories that were also shared with other Nexstar stations in Texas Online. KXAN utilized Facebook Live and digital chats on KXAN.com to explain the project and to take questions from viewers. More than 50 KXAN staff members worked on the project in some way, including the 7 reporters and 5 photographers behind the stories. The team traveled across the country, including California, Ohio, and all over Texas, to report these solution-oriented stories. This project launched as a partnership with the Solutions Journalism Network, which provided guidance and feedback over the course of the 8 months it took to complete. Let's take a look.
Sometimes the signs aren't this easy to see. KXAN has dedicated our resources, traveling across the state and the nation, discovering innovative ways schools are approaching mental health. From school bus drivers spotting warning signs to how motivational notes are helping boost self-esteem. We want to start a conversation that could lead to solutions right here at home.
Online now, explore our digital project, Save Our Students, Solutions for Wellness and Safety. See why we're taking a closer look at this important topic. Stories from across the nation, in-depth conversations with school workers on the front line, interactive analysis of what's happening with mental health and your children, plus community outreach and resources to get help for your family. It's all online now at SaveOurStudentsTX.com.
Santa Fe was a school shooting that happened in 2018. It's kind of what led to school districts really focusing on where can we get the right solution for our students and get this done correctly.
There are so many parents out there who have talked about what's happening in their child's school that we're seeing enough problems that we felt like this is something that needs to be tackled right now, and we want to take a different approach to it.
Solutions journalism is actually looking into things that are working.
What were advantages of this solution?
Can they be implemented in our community or other communities?
Our research took us to Lubbock, our research took us to Ohio, and our research even took us all the way to California. If you turn to a program that is showing success,
Training its bus drivers to look for students who are potentially suicidal.
a group of moms starting a movement.
There's this new mental health care consortium.
Enhanced video security, enhanced radio systems.
why would you not want to consider that for your own community?
This is a project we've been working on for months. It involves almost 40 people from our newsroom. That's half of our entire staff. That's how important this project is to us. We want to make sure we do it right.
The fact that we work at a place that has slowed down and said, what are some of the things that are most fundamentally important to our community, and how can we do a deep dive and address that? It makes me proud.
Look for our KXA and pop-up newsroom in the first base hour concourse. Good luck to the Express team.
And so it's back to school time, and are your kids do they get nervous? They get excited? What is the?
She gets excited. Anthony's the one who gets nervous. He gets nervous.
He started kindergarten.
And what are your thoughts on that?
His concern before school started was about bullies.
Which is an open conversation about what's working, maybe what's not working, and some things that probably parents should know about how counseling works.
Adults often don't think about what teens are thinking.
Like, your parents want you to talk to them about stuff that you go through, but like when you tell them stuff, they react different.
I would first like to take an opportunity to thank KXAN for tackling such an important topic.
We are encouraging you to text your questions tonight to our panel and simply send that message to 22333.
We're so happy to have you here tonight. My name is Roger Wallace. I'm the sports director at KXAN TV, and I'll be your host for tonight.
To simply share ideas from one community to the next and get people thinking and talking and ultimately taking action.
I want to express my thanks to KXAN for really, giving us the opportunity to have this conversation, for doing some great stories, because this is what we need. We need to talk about this.
Anytime when we are bringing mental health to the forefront in this way, it's really important because, again, it creates opportunities for us to have conversations that maybe we haven't had before. I firmly believe that journalism has this opportunity to be a powerful force for bringing to the surface some of the concerns of the community in a really powerful way. Pairing that with these town hall events where you really had an opportunity then to have local experts come in and talk about the things that were happening in their own school districts.
Here on KXAN News Today, superintendents from across Central Texas are giving you insight on the safety and well-being of your children.
Just this year, we've added a brand new position, a licensed clinical social worker.
It's important that we support our students in many different ways. We also have 45 mental health centers throughout our school district.
We're really working with an initiative called 100% Haze to make sure that every single kid is involved in something.
Watch KXAN News Today.
Accepting on behalf of KXAN is Josh Hinkle.
Hello, I'm Josh Hinkle, Director of Investigations and Innovation at KXAN TV. On behalf of the entire station, we would like to thank Mental Health America for honoring our Save Our Students project with the 2020 Media Award. We would also like to thank our partners, the Solutions Journalism Network, for their support and guidance as we focused on such important issues in our nation today: school safety and mental health. To explore KXAN's entire project, go to saveourstudentstx.com. Again, thank you so much.
Next, Lift the Mask, Portraits of Life with a Mental Illness, a documentary by the Quell Foundation. The film reveals and addresses systemic problems with social and cultural stigma and the challenges associated with gaining access to effective treatment. The film captures 6 individuals from a variety of backgrounds, living with different mental health diagnoses, who, in recounting their own experiences, speak directly to these issues. It addresses how the criminal justice system is ill-prepared and under-resourced to manage the mental health of their population of people, and sheds light on the difficulty of finding and maintaining medications that work once achieving access to proper and timely treatment. Several of the film's subjects speak directly to the deleterious efforts associated with a severe shortage of mental health care providers. Each story shares how the acceptance and understanding of a loved one, often a parent or partner, is one of the most crucial and challenging aspects of proper care for somebody struggling with a mental illness. Let's watch.
It began with having much more paranoia than any child should have.
It's like you can't come up for air. It's almost as if all your hopes and dreams just disappear.
He would say, Dad, I'm going to tell you, it's like I'm sitting on the steps watching myself do something that I wish I wouldn't do, but I can't stop myself.
What many people think is that this is a moral issue, not a medical one.
So whenever you go to a psychologist, you are crazy. Because of that pressure, I felt kind of like, I shouldn't do that because I don't have a problem.
Is this going to be the new Michaela? Is that old Michaela gone? Are we ever going to see her happy again? Is she ever going to smile again?
He had started to feel really badly. He called the psychiatrist, like, we can see you in January. Like, we can't wait until January. So literally he was like white knuckling it.
I was right here looking at that house and realizing that he would never be back here again.
I would tell people that she died of cancer because that was respectable.
If you had a friend or a loved one that could not see the light at the end of the tunnel, would you go sit with them in the dark?
There's always a piece of me that's hopeful, always.
She said, Mom, I feel better.
What reaches people the most is when they find out that someone in their daily life has gone through something terrible and they're still the same person that they had grown to love. That's how the fear stops.
Accepting MHA's 2020 Media Award for Lift the Mask is my good friend Kevin Lynch, President and CEO of the Quell Foundation.
My name is Kevin Lynch, and I'm the founder and the CEO of the Quell Foundation. I'd first and foremost like to say congratulations to the other award recipients this evening. I would also like to thank Paul Gianfredo and Erin Wallace and the entire selection committee for recognizing the Quell Foundation for this very prestigious award. I would also like to say thank you to John and Nina Stanley of Mod Worldwide for joining me as executive producers of Lift the Mask, Portraits of Life with Mental Illness. Director Mark D'Agostino and the team at Mod Worldwide devoted months of tireless work to rendering 200 hours of filming into this powerful one-hour documentary. This award belongs to the selfless people that invite us into their personal lives to share the challenges that they face living with or supporting those with an unwelcomed and unsolicited mental health diagnosis. Each of you have given a beautiful face to mental health and removed the stigma and normalized the conversation for the thousands of people around the country who have seen and heard your stories. So thank you to Liz and Dennis Charpentier, to Michaela Kearney, to Kara Callett, to Claire, Tanya, Michael, and Michelle Griffiths, and to Abdul Ali Al-Kaf. Thank you so much for what you've done for mental health. This documentary has been privately viewed by over 5,000 people in the last year. Attendees were invited to participate in the national study to determine the efficacy of the film's ability to positively influence attitudes, understandings, and behaviors around this stigmatized subject of mental health. Our research, being conducted in conjunction with Penn State Hershey Medical Center's epidemiologist, Dr. Kristen Schneider, has shown that there was statistically significant increases in the respondents' willingness to rent a room in their home to somebody with a mental health illness, to work with or recommend someone for a job with someone that they know, to introduce someone with a mental health illness to their friends, and to welcome someone with a mental health diagnosis to be the caretaker of their children. These are powerful and telling results. Mental Health America, recognizing the Lift the Mask Portraits of Life with Mental Illness for the Media Award, is yet further attestation to the value of film in overcoming a negative stereotype and stigmas. Over the last few months, the world has been thrown into a global pandemic. As the number of cases of COVID-19 increases, so did the associated experiences of anxiety, depression, and suicide. On behalf of the Qual Foundation, I would like to congratulate Mental Health America for their ability to stop on a dime, change course, and bring this event to a virtual audience. Once again, you have addressed what is most needed in this country today, to recognize that mental health and the effects of COVID-19 are as important to address as physical health effects, and you are doing so in an equitable way. Once again, thank you so much for honoring us with this award.
Next up, WSOC-TV out of Charlotte, North Carolina, led by executive Kim Holt and anchor Erica Bryant, committed to telling the community impact of mental illness across its 22-county viewing area. The station developed an hour-long primetime television special focused on mental health entitled Charlotte's Hidden Crisis. The live broadcast featured pre-recorded vignettes featuring individuals and families discussing what it's like to live with a mental health diagnosis, suicide attempts and loss, and the challenge associated with seeking mental health services. The station also developed a printed and online resource guide that featured mental health resources. To ensure that viewers connected to those services, the station hosted a live phone bank that was staffed by local mental health advocates and clinicians. Call bank volunteers answered more than 700 calls from Spanish and English-speaking callers on the day of the broadcast. The station also began working on a second Charlotte's Hidden Crisis live broadcast for December 2019. This live broadcast focused on veterans' mental health, normalizing therapy, social media and mental health, the stigma of medication, and the signs of suicide. WSOC made a commitment to use appropriate, non-stigmatizing language and accurate data when reporting on deaths by suicide and mental health overall. Here's a brief summary of some of their work.
People don't understand mental health, it's there and it's real. There shouldn't be that stigma around it.
It's not a social thing, it's not a race thing, it's an everybody thing.
For a long time, I suffered in silence.
I would get these scary thoughts.
I just couldn't breathe.
I had no idea I was dealing with depression.
I knew as a mom something was off.
I didn't know how to talk to anybody about it.
You were told, man up.
What's wrong with you? You need to be strong.
Cheer up.
Suck it up.
Don't cry.
That one thought can lead to a million thoughts of why you're not good enough.
There is help.
There is hope.
It's going to take a village.
It's okay. Just say, I need help.
I wasn't crazy. I just needed direction. I needed understanding. I needed community. I needed love.
I can overcome this.
Recovery is possible.
Mental health is there, and it needs to be talked about.
You're not alone.
When you get the help, that's when you find the hope.
Charlotte's Hidden Crisis. There is help. There is hope. Now, from Channel 9 Eyewitness News, Erica Bryant and Scott Wickersham.
It's an epidemic that doesn't see race, gender, or age, sometimes hidden behind a forced smile. Other times, the pain is on full display.
1 in 4 people are affected by mental illness. It's not talked about enough, and too many people are going through this alone.
While you may not have a mental health issue, chances are a loved one, a friend, or a neighbor does.
Well, tonight we are here to show you there is help and there is hope.
Many of you may not know where to turn, but there are resources for everyone, even for those who don't have insurance.
But how do you know if someone is struggling? What signs should you look for? And how would you even start that conversation?
Tonight, we take you through all of that and introduce you to survivors who explain what helped them to overcome their darkest moments.
This room of mental health professionals has been talking to people, accepting phone calls from people from all walks of life for the past 8 hours. You can see them here right now. It looks like all of them are on the phone right now. It really just shows you the need. They have been answering calls from veterans, from women who've just given birth, from people of all ages dealing with PTSD, anxiety, questions about suicidal thoughts. They are connecting people to resources in their community. Each of them has one of these, a resource guide right in front of them, and there's a number on your screen that you can call to connect with one of these volunteers. They will help get you help in your community.
We've also compiled resources for every county in our viewing area at WSOCTV.com and on our app. Just look for the Mental Health Resources headline there under the News tab. If you scroll down, you can see a map here, and there's symbols for different areas. I mean, click on Charlotte, and you can see a full list of resources for each county.
And now a quick note for our Spanish-speaking audience. Contamos con operadores voluntarios en español con información sobre salud mental. Los teléfonos están abiertos hasta las 10 de la noche. El número es 1-800-950-3739.
We asked 4 people who know the pain and heartache of substance misuse to write down words that open the floodgates of guilt and shame.
My word is drunk.
Dope fiend.
Junkie.
I chose drug addict.
We say misuse instead of abuse because it is more accurate and it is not considered a put down. The words they chose are addict, junkie, dope fiend, and drunk. Of course, there are many more.
Those kinds of hurtful words keep the cycle alive, because what would happen is it would make me feel so bad about myself. What I would have to do is drink to make that pain go away.
People facing mental health challenges also have words they'd like to see stricken.
Mental, loony, cuckoo, crazy, deranged, sick.
Dr. Trasia Black is a counselor with Genesis Project One.
We battle shame. That's one of the biggest things that folks work on in therapy, is how they see themselves. And all those words that people have used, they stick.
The result? People avoid therapy. Now you know what not to say. What should you say? For mental health, never call someone crazy. Say they live with or have been diagnosed with a mental health disorder. Instead of alcoholics and addicts, try people with alcohol or drug problems or dependencies. Instead of former addicts, say person in recovery.
Accepting the MHA 2020 Media Award for WSOC is Erica Bryant.
Hello, I'm Erica Bryant of WSOC TV in Charlotte, and it is with great pride and gratitude that I accept this award on behalf of our entire team. The issue of mental health truly is Charlotte's hidden crisis, but we're working to change that. We see it as a responsibility and an honor to serve our community by connecting mental health resources to those who need them most. I want to recognize and publicly thank our local chapter of Mental Health America of Central Carolinas. We could not have done this without their support and expertise. It is inspiring how much the entire team there cares about the Charlotte community. And to everyone else who's doing this work across the country, thank you for what you are doing and for acknowledging our efforts. There is still so much more to do to make sure that our community knows that there is help and hope. And we want you to know we're here for it. Thank you.
Finally, My Ascension, a feature-length documentary that chronicles a suicide attempt that left 16-year-old varsity cheerleader Emma Benoit paralyzed. Her journey propelled her on a mission to use her painful experience to help others find hope, while shining more light on the fact that 20 young people die every day by suicide in the United States. The film shows Emma's inspiring journey and quest to walk again as she works to bring Hope Squad, a school-based peer-to-peer suicide prevention program, to Louisiana. The film also highlights the stories of two remarkable young people who tragically did not survive their attempts. And we learned firsthand from their families, friends, school officials, and suicide prevention experts about the devastating effects of suicide and what can be done to prevent it. Let's take a look.
If Emma Benoit is gone, then no one has to think about her anymore. No one has to worry about her anymore. She's gone, and that's it.
Now, my one looks at her and said, "Oh my God, my daughter shot herself." Okay, is she breathing? Yes, ma'am, she's breathing. Stay with me, baby girl, please. I want you to say now every single time she takes a breath in. Now. Now. Now.
I didn't have a clue she was struggling.
Seeing her in ICU, she looked broken, completely.
You start thinking immediately, where did I go wrong? Cheerleader, great grades in school, popular. Not Emma.
They said I may walk or I may not. They said there's a 1% chance that I will. For as long as I can remember, I have struggled with anxiety and depression. Well, it's the first time I've ever admitted that.
There is no age that is more likely to think about suicide and attempt suicide than high school kids.
We're afraid to talk about suicide. We think if we talk about it, it's going to give someone the idea. When the reality is young people don't want to die, they want their pain to go away.
But your story will say to someone out there thinking about death, maybe I need to pause.
I don't know if I want to put it out there for the world to see what I really have been through and what I'm going through. How? I just know that if it saves at least one person, or even helps one person to just stand up and be like, I have those feelings and I have those thoughts, and not to be ashamed of it, then it's worth it.
A local teen who lived to talk about her suicide attempt is sharing her story with the world.
One of the things I'm most grateful for is this new perspective I have on life. I really do see colors brighter.
If we could do a better job in training how to help each other and actually begin to empowering young people, that to me is the secret.
I'll be your biggest cheerleader, but if you tell me you're good and you're not, I'm gonna get in your face.
Yeah.
And we're gonna have some talking to do.
I was just having so much suicidal thoughts, I would cry every day. I'm sure you understand.
Yeah, I do. I get it. It's so necessary that people understand how you're feeling.
As you know, St. James Parish lost a precious 15-year-old 10th grader.
Your pain was gone, but ours just began. You can't help but think, why? Why was I safe, but he wasn't?
We're drowning out here. We need a lifeguard to send out a raft and pull us ashore.
This is not a school issue. This is a community issue. I want you to see what you can do for suicide prevention.
Every single day I wake up and I'm like, how did I get here? But then I have to look back and remember how far I've come. To really be thankful. Maybe this is my calling, you know? Maybe my pain and suffering can help someone else.
I have this weird feeling. It's called hope.
It wasn't an easy journey coming to faith, but I'm working on it.
Accepting MHA's 2020 Media Award for My Ascension is the film's director and producer and 2019 Clifford Beers Award winner, Greg DeCherry, along with the star of the show, Emma Benoit.
When I say mental, you say
Health.
mental.
Health.
Mental.
Health.
America.
Mental Health America. Yes.
Okay, we need to practice a little more, but thank you so much, Mental Health America. We're so grateful for being a 2020 Mental Health America Media Award winner for My Ascension. It really means so much to us, and it's really amazing to get that validation and support and acknowledgement from an organization, particularly one of the stature of Mental Health America. as a person who's in recovery for mental health issues and has worked in the field for a while, I know that would not even be possible for someone, like me to have been able to work in the mental health field if it really wasn't for Mental Health America and all the amazing advocates that y'all have supported over the years. That really have made it possible for people like me or people like us who have mental health challenges to not only stay alive but to really thrive. So we're very excited about this, and I'm going to shut up now and let the star of the film say a few things.
Well, first of all, thank you so much for this honor of an award, Mental Health America. It means so much for Greg and I to receive an award like this. I mean, it has been a journey working on this film for the last, coming up on 3 years now. So, yeah, definitely did not foresee this in my future at all, but it is something that I'm extremely grateful for and a passion that I feel like burns stronger every day. So thank you again to Mental Health America for this phenomenal award. We really, really appreciate it.
Yes, and we're really grateful for the opportunity. The film is really about spreading awareness and really letting people know the importance of the topic of suicide in general, but really youth suicide. As you may or may not know, 20 young people die every day in the U.S. to youth suicide, and it's only going to change if we all work together. And so we really hope to work with you, and you can help spread awareness. Our film will be coming out hopefully fairly soon as we navigate this COVID release dates. But stay tuned. Check us out on the web, www.myascension.us.
Yes, sir.
All right. Thank you guys so much.
Thank
much
you guys.
Love. Appreciate you.
Take care. Bye-bye now.
Bye-bye.
Such amazing examples of using media platforms to make a difference in mental health. Congratulations to all the winners of MHA's 2020 Media Award. And thank you for joining me in celebrating their important work. We'll take a brief break now. Just don't go too far.
Hey there, my name is Whitney Ball, and I oversee the Associate Membership Program here at Mental Health America. This program gives both for-profit and nonprofit organizations a chance to become a part of MHA's family and larger network. As a member, you also receive unique access to resources, tools, and opportunities that help you support the mental health of your community and thrive. I'd love to share more about how you can join and get involved in the program. Feel free to send me a chat via the conference platform or an email at wball@mhanational.org. Thanks, and enjoy the conference.
Hi everyone, my name is Maddie Reinert and I'm the Program Manager of Population Health at Mental Health America. I manage the MHA online screening program, which is a collection of 10 free, anonymous, confidential, and clinically validated screening tools that you can access on your own online, and they're a great way to check in on how you're doing. Since we launched the program in 2014, we've had over 5.5 million people come on and take a screen, and 57% of them had never received any kind of treatment or supports for their mental health before, so they're able to access this information for the first time. And with the optional demographic questions we ask when someone comes on to take a screen, we're able to learn more about who is experiencing severe mental health challenges, what their experiences are, and what kinds of treatments and supports they're looking for. So if you're concerned about your mental health, take a screen at mhascreening.org, or if you want to know more about the program or what we've learned from the data about our screeners, you can email me at mreinert@mhanational.org. Thanks!
Welcome back. Our next conversation is with the First Lady of New York City, Chirlane McCray. Chirlane has redefined the role of First Lady, managing a robust portfolio to advance an ambitious agenda in support of all New Yorkers. Nationally recognized as a powerful champion for mental health reform and dubbed one of Time Magazine's 50 most influential people in healthcare for 2018, Chirlane created Thrive NYC, the most comprehensive mental health plan of any city in the nation. She also spearheads the city's Thrive Coalition, with more than 200 mayors, county officials, and thought leaders from all 50 states, advocating for a more integrated and better funded behavioral health system. As chair of the Mayor's Fund to Advance New York City, Chirlane also brings together government, philanthropy, and the private sector to work on some of the most pressing issues of our time, including mental health, youth employment, and immigration. She also launched and leads the NYC Unity Project, an unprecedented citywide effort to make sure LGBTQ young people in New York City are safe, supported, and healthy. And as co-chair of the Commission on Gender Equity, she is a persistent voice for creating a 50-50 city and world. In partnership with New York City's police chief, she leads the Domestic Violence Task Force. And in 2015, with her signature, New York City became the first city in the country to join the United Nations Women's Safe Cities Global Initiative. Shirlane is a graduate of Wellesley College. She and Mayor Bill de Blasio live in Gracie Mansion, the official residence, and are proud parents of Kiara and Dante. Welcome, Shirlane. It's good to see you again.
Thank you, Paul. Thank you so much. I'm really so happy to be here with you.
I know, I wish we could do this in person. I'm sorry we have to do it remotely this way, but this is the world we live in today, isn't it?
It sure is. And I just want to thank you for still being out there in any way that you can, for sharing your personal story. It means so much to other families who have struggled. And I also thank Mental Health America. I recently saw that 88,000 more people have reached out through your portal with anxiety and depression during this crisis. And Mental Health America is such an important lifeline, especially in this moment.
Well, I really appreciate that. Yeah, it's been amazing to us how many additional people have come into our website and done a mental health screen, and how many of them are having such serious issues. I mean, nobody anticipated this 6 months ago, but this is the world we're living in now.
Yeah.
So you were at ground zero for the first weeks of the pandemic. So could you just share with folks what it felt like at that time?
Well, let me tell you, it's very hard to describe the waves of discomfort and distress, fear, anxiety. What has never been more clear is that everyone needs more mental health support. What has never been more clear is that, you know, we are able to, when we have to, adapt to the needs of people, you know, as government. Right now, and certainly in the beginning, children were restless and struggling. Parents were losing their jobs. Healthcare workers were traumatized by the suffering, so much suffering and death. We're in a better place now, but it has not been easy. And it has required a lot of resilience, a lot of looking at things differently. Our structures, whether it's healthcare, work, and how we get our basic services like food. I think it's changed our understanding of how we live.
Tell me just a little bit more about this. I want to get into some of the sort of policy pieces in a little bit. But just, you know, how we live. How has it been for you and your family? I mean, you're in this fishbowl in addition to having to go through what every other family has gone through. How have you done the last few months?
Well, I think I went from relief from the, you know, and not having to do the regular schedule, because, you know, a lot of what I do, what my husband does, we do events. And there was, for me, I have to admit, a certain amount of relief from that. But then it was all about how can we help our people, right? It was figuring out how to adapt, how to figure out, you know, people's food needs, distribution of PPE, so many different difficulties to address. Education centers for our children. You know, it's a long list, and the work continues. Right now, we're trying to opening up our schools, but it's a challenge like no other, because there are so many layers to the way that we live that have been threatened or challenged by this virus.
Yeah, it seems like those layers have really just disrupted everybody and really has undermined the mental health of everybody in the nation from our perspective. I mean, going into this, we used to say, well, half of Americans are going to experience mental health challenges during the course of their lifetime. But it's like all Americans, all people in the world have been experiencing these challenges all at once, it seems, doesn't it?
Yeah, absolutely. I mean, we, again, it's never been more clear that everyone needs mental health support, that we need to have mental health in all of our policies. We made a very quick switch from life as normal, regular life, to all of a sudden we have telemedicine and working from home, and I'm just grateful that in New York we had some experience of across sectors. We had Thrive. We have these 30 programs across a dozen agencies and community-based organizations as well, which helped us. It helped us to have social emotional learning already in place because we had launched it last year to help our children identify their emotions and be able to learn how to manage them. They got a lot of practice during this difficult time. And I can't stress how much we have recognized that having mental health programs across all of these agencies, whether it's Department of Health or parks or schools, police, has made a difference here in New York City and how we handled this crisis. I mean, we were ready to help our healthcare workers who are traumatized because of the burnout, the suffering, the death. We were ready to help them. Of course, we needed more help, but we at least had structures in place to give people the kinds of attention that they needed. And not everyone had that. So yes, we were hit really hard by the virus, but I think that we were lucky or privileged in that we did have some structures in place.
That's one of the things that I think people don't understand well enough. I think outside of what I'll call the policy arena or even the political arena, that I was a mayor, a long time ago, but I was a mayor and knew how important it was to prepare for things that might come. And I think that you have just done a remarkable job, and your husband has as mayor, I think over the past few years, anticipating, not that we would have this pandemic, but anticipating that kids were going to need additional support anyway, that public employees, essential workers would need additional support anyway, that the population would need additional support anyway. So, you get a lot of credit in my book, and maybe not everybody would see that, but I think those of us who've been on that side really can see just how important all of what you had done leading into this year was in making a difference in getting control over as much of this pandemic as anybody could get control over, and really helping people see, that there's light at the end of the tunnel. So thank you for that.
Thank you.
So let's just turn our attention a bit to New York City itself. I mean, it has always been an amazingly multicultural city. And in its diversity today, it looks a lot like most of the nation's going to look a generation from now. So maybe people don't even realize that today more than half the population is non-white. And even though you've got great teaching hospitals there and all kinds of assets, the non-white populations haven't always had the same access to neighborhood healthcare services and other supportive services as others. And communities with the highest mental health needs may be the least likely to be able to access mental health resources during and after the pandemic. So putting on your hat as chair of the Task Force on Racial Inclusion and Equity, can you talk about the approaches you're taking in New York City to tackle some of these issues, particularly the lack of mental health care, but in general, these issues in disenfranchised communities, and maybe help others who are thinking about doing this get their heads on straight?
Yes, well, as you said, structural racism has become ever more evident during this crisis. People who have already been in some kind of, people who have been disenfranchised, people who have struggle to have access to good jobs, good education, good health care, have been put in an even more difficult position. And when you think about it, well, when you think about it yourself, like what would trigger a mental health crisis in your own life? A sick parent, loss of employment, inability to pay your bills, isolation, all of those things, would hit very hard. And they're all happening at the same time for so many people in our communities of color. I met with a church leader not long after the beginning of the crisis who had lost 30 people in her congregation. And on top of the loss of life, again, hundreds of thousands of people have lost jobs, and our seniors and young people are really struggling. I think for us, for the task force, and we've got 65, 70 members of the task force, mostly people of color who were born in or come from or have lived and worked in all of these communities, 27 hardest hit communities, that it's been an opportunity to give back in a way, in a very focused way that we haven't had before. First of all, getting to know each other, because in a big place like New York City, it's not a given that every person of color in a senior position at an agency knows each other. And putting our brains together, to figure out what can we do for our communities. And we've had some infrastructure with NYC Well, our 24/7 helpline, with social emotional learning, with NYC Care, which we started last year, which is healthcare for everyone, even our undocumented. What we were able to do is build on all of those things to make sure that not only that these services were available, but that people are actually connecting to them. It's one thing to provide a service, it's another thing to make sure people are actually connecting. That's a different job. So we expanded NYC Care, again, which we had started, but we hadn't expanded to all of these communities yet. So we can make sure that everyone has access to a primary care provider. And that it means that they will also have care to specialty care. They'll have mental health care. We are building on Thrive and making sure that we get trainers into these neighborhoods to make sure that that people get mental health first aid training, that people have access to workshops to help them overcome their trauma. We want people to have skills that actually, or training, I should say, that stays in the neighborhood. And that's why we're sending trainers to train other trainers, so that these people will help strengthen their own communities so that people can help themselves. But I have to say that some of the biggest hurdles have been in terms of things like broadband. We're not we don't have a rural community. Excuse me. We're not talking about rural communities, but we have hundreds of thousands of people who don't have broadband. Imagine what it means to not have internet service in 2020 and during a pandemic when people can't go out necessarily to get the care they need. So that's something that we are working on. We're providing broadband to thousands of people for the first time, and we're working on the barriers that have prevented that from happening before now. It's a lot to do, it really is, but I know that by the end of this pandemic, we're actually going to be in a stronger place. These communities are going to be in a stronger, better place because of the focus that we've been able to put on these communities, and not just, like making sure they have food and making sure they have devices for remote learning and all of those things, but also so that they have job training, skill training, that they have tools that they can help continue to strengthen their own communities.
I think that's one of the things that we sometimes, forget. We think that strengthening people is simply about strengthening their health or strengthening their financial circumstances or strengthening the neighborhood that they live in. And we forget it's about strengthening everything. It's about strengthening the entire environment. And, we didn't get where we've gotten to overnight. And, I think some people are hoping for the magical answer out there that, the miracle that's going to happen where overnight, everything changes and everything is just rosy. You've got to be investing in all of this stuff. And I know that for a lot of people around the country, that's sometimes challenging to think, well, how do we do that? We have limited resources. We've got, whatever, we've got excuses. We've got limited resources, but no limit to the excuses that we've got. And I think that, one of the most important things you've done as a model is just pull the resources together that are there and then try to use those to build additional resources that, as you say, will remain in communities, will remain in neighborhoods, and will strengthen all the people living there. That's not really the kind of picture that's kind of painted often of more progressive areas. But in fact, that's the reality of what some of the most progressive areas are doing. Wouldn't you agree?
I agree 100%. For example, with our task force, we are not necessarily pouring a lot of new resources into these programs or services. We're using our existing agency funding, we're using existing resources, but we're using them in a different way. We're looking at well, how are we using this money? Why is it going here rather than there? And some areas that's, it's a thinking very differently, and some areas it's thinking creatively. There is really, I look at us and we're the richest city in the country, right? We have so many resources. Why isn't it possible for us to change this paradigm that we're in? And it really does come down to just saying what our priorities are, changing our priorities. Change is possible. I feel like this pandemic has in many ways flipped a switch, that we have seen that so many of the things that we thought, just couldn't work or weren't possible, are all of a sudden we're using. And I think, telemedicine is a great example of that. People have kind of fought against that for many years, and look how we're using it so fluidly right now. Look at working from home. Look at remote schooling. These things may not be ideal, but look how possible they are. And look at even in terms of the protests and the culture, our cultural and social life. I look at our newspaper, for example. You look at the New York Times, where if you look at the paper to these last few weeks, and you look at the paper a year ago, you will notice that there are Black people in almost every section of the paper now, which is not, and it's not tokenism. It's like Black people all of a sudden, and people of color, have a significant and consistent and contributing part in this world. And it makes me angry because it just shows how easy it was to do. I mean, that it could just happen like that in the course of a few months. But it also makes me angry because I know that we could do so much more if people just thought a little differently, right? If people just didn't accept the conventional way of doing things and say, we're going to make this happen, and we're just going to all put our heads together and find a way to do it. It can happen. Why does it always take so much pain? It's tremendous pain to make change. I feel like the pandemic, I mean, there's not a lot of good things that have come out of the pandemic, but there are some good things. And, in terms of how we look at each other, and the things I mentioned earlier, telemedicine, remote learning, all of that, is like showing us what is possible. But it has taken great pain for us to get there.
Yeah, and I'm with you. I agree completely with all of what you said. I mean, honestly, this is easy, right? This was easy in many respects to make this transition that we've seen. And yet, it has taken so much pain from so many people for so many decades and generations to get there. And the worry I have is that, the ease of these transitions, in a sense, become almost for some people the tokenism, right? We're now, because we elected a Black president, we now live in a post-racial, society. Well,
Right.
Right? No, we didn't. But it's like we ticked that box for some people, and it's okay, now we tick that box. So now you see all of these additional, people and stories and narratives and perspectives elevated into, say, the New York Times. But, I don't see them yet in the New York Post. So when do we, I get to say that, you don't, by the way. And, but when do we just say, it's not enough, right? The pain has been too much, but we've got to continue to push people forward. We can't rest and relax. I think sometimes, that happened after the horrible times we went through in the 1960s, that, we got to the 80s, right? And we went through 8 big years of nationally resting and relaxing, feeling like we had, we did all that, right? We got through all that. Now it's time to, invest in the economy again, and to do all that. And it just, it feels like, I want this to be a more solid foundation, I think, is what I'm getting at. I agree with what you've said and where you're coming from and all this, but don't you just hope this is the one, this is the moment, this is the time. It's finally here, and we're going to be able to build on this one and not have somebody else just come along and tear it down again?
Well, I think that, when we do go through times like this, that there's change that cannot be completely wiped out. Unfortunately, we do seem to take a few steps backward every time. But I do believe that this is a great big leap forward, and that this is a time of great reckoning. I think that with the protests, the economic distress, the health crisis, everything that we're going through right now is going to lead to a generation of adults, because the young adults going through this now are going to be shaping the future of this country. I think it is going to change the way things are done. I know that people are having uncomfortable conversations. They're asking tough questions. They're thinking about what they value. And I think this is especially true of our young people, because they are in what I call the great pause. They are thinking about, oh my God, they're not thinking necessarily about, well, how can I start my career? They're thinking like, what kind of work can I do? How can I make money? How can I meet people? How can I go on a date? How can I make my mark on the world? What do I believe in? With everything that I'm witnessing right now, remember, many of them have never had this kind of experience. They have not seen a George Floyd, right, incident. There has not been that in their life. They haven't been through necessarily great economic distress as we're going through right now, or beginning to go through, depending on where people are sitting. We're revealing history that has not been revealed before. I think that we won't go back. We won't go backwards completely. That this is a chance that we have to make a giant leap forward, and it remains to be seen what we will take from it. But I have hope. I really do. I have hope that we will take a lot from this experience and to make this a better world.
Well, I hope people are listening to you, because I think you're showing people a way forward, and in the work that you're doing and in your own dedication to it, that you're deriving hope from these circumstances. I think it's just really important, because I do think a lot of people are feeling lost, and they need to see people, like you, who are saying, okay, I've lived through this, and my community's coming through it. We've got a lot of work to do, and we don't have perfect systems and a perfect society yet, but look what's happening. Look at all the positive things that are happening. So I know you've said you derive hope from the energy, the enthusiasm, the young people who are, I think, challenging conventional ways of thinking. Any other kind of last words for them or for the other people who are watching about how we hold on to our hope these days?
Well, Paul, we're still here, right? On all people who are listening, we're still here, right? And I hope we're all still fighting. I'm fighting. We've lost so many people in our communities, and like I think about that minister who I talked to had lost 30 people. We've lost heroes like John Lewis, who I was very pleased to have an opportunity to meet and talk with just a few months ago. There's a champion, if you ever saw one. He never stopped fighting. We can never stop fighting. We have to be inspired for those who are looking at us, people who are watching us. We have to inspire others. So I hope people will get out there and vote. Vote for people who will be champions for us going forward. I hope people are filling out the census. That is very important. I hope people will continue protesting and get into good trouble, good positive trouble by challenging the status quo. That
sounds like something you might have told your kids at some point.
Absolutely, absolutely. They know that in my lifetime I've experienced a lot of pain and a lot of change with civil rights, the Black Power movement, feminism, gay rights, AIDS, the opioid epidemic, and whatever else. It's that right now this is a great reckoning that with racism and social injustice and mental health reform, we're going through a rebirth, and rebirth is never easy. We have to keep at it. Look at the conversations we're having. Keep protesting and really invest in our young people who will be leading the way, who are leading the way already in many cases. And we can do this. We got to keep hope alive.
Yes, keep hope alive and keep fighting, Shirlene. And I'm going to keep fighting on your team. So thank you for joining us today. I really appreciate it.
Thank you, Paul.
And next up, we will hear from MHA's Executive Vice President, Mary Giliberti, and Rebecca Coakley, Director of the Disability Justice Initiative at the Center for American Progress. Mary?
Hi, I'm Patrick Hendry. I'm Vice President for Peer Advocacy Supports and Services at the National Office of Mental Health America. I'm also the director of a program called It's My Life Peer Partners. This program was designed by peers for peers. The purpose of the program is to assist people who feel marginalized and lonely in a confusing world to build healthy relationships and friendships that will support them in their road to recovery. For more information, go to mhanational.org, click on Center for Peer Support, and follow the prompt to It's My Life Peer Partners.
Thanks, Paul. Hi, everyone. My name is Mary Giliberti, and I am the Executive Vice President of Public Policy here at MHA. I am so excited to introduce and chat with our next speaker, an amazing disability advocate and my friend, Rebecca Coakley. Rebecca is the director of the Disability Justice Initiative at the Center for American Progress, where her work focuses on public policy issues for disability community. Most recently, she served as the executive director of the National Council on Disability, an independent agency charged with advising Congress and the White House on issues of national disability public policy. She joined NCD in 2013 after 4 years with the Obama administration, where she worked at the Department of Education and the Department of Health and Human Services, which is where we met, and also did a stint at the White House working on diversity and inclusion issues. In 2015, she was inducted into the inaugural class of the Susan M. Daniels Disability Mentoring Hall of Fame, and was the recipient of the Frank Harkin Memorial Award by the National Council on Independent Living, one of the most important awards for the disability community. Welcome, Rebecca.
Thank you so much, Mary. It's wonderful to be here with you today.
Well, great. Let's start off talking about the Disability Justice Initiative, since you are the founder of this initiative, and I know you, and I know you are very deliberate with how you talk about things. So what does justice mean to you in the context of disability inequity, and how does your own experience inform that?
So the framework of disability justice came out of the Bay Area in the early 2000s, largely promoted by an organization called Sins Invalid and Patty Byrne. It really focused on the notion that our end goal is not the acquisition of rights, because we can have all the rights in the world, but that doesn't mean that we're treated as equal when we're out in society. And so what would justice look like? And so the disability justice framework is really grounded in roughly 10 different components. Language which is pretty well known by a lot of folks, things like cross-movement organizing and cross-movement solidarity, being led by folks that are the most impacted by the various issues that people are living with. Actual intersectionality, so not just diversity as a lot of organizations misuse intersectionality, but actually grounding conversations in what does it look like when racism and ableism are compounded, let's say in the context of COVID, or in the context of criminal justice reform. And our center was built, we just celebrated our 2nd anniversary. We are the first center of our kind that focuses on disability policy at any of the DC-based like quasi-political organizations or think action tanks, as our CEO likes to call us. And our focus has really been, how do we bring the disability community to the table on progressive issues? And how do we bring the progressive community to the table and rallying support around disability issues? You know, for me, I grew up in the disability movement. Unlike 80% of folks in our community, I'm part of the 20% whose parents had the same disability that I have. And you know, since we're doing this remotely, hi, I'm a little person. You know, that's typically what people perceive of as my primary disability. You know, I also come to this space as a person that lives with anxiety, as a person that has a very obnoxious, once every 3 years or so, reoccurring heart condition that's really annoying. But because I have an apparent disability, a lot of times people presume that that's the one that impacts my life the most significantly.
So you mentioned in your remarks COVID-19 and how that has exacerbated different disparities that we've seen in the health and the mental health systems. Can you talk about how COVID-19 is affecting the disability community and what we could do to better meet people's needs?
You know, honestly, for us, we started mourning our dead back in February. It's the reality of the times that we live in. It's the reality of having the understanding that people with disabilities across the board, whether it be people with mental illness, people with chronic health conditions, people with mobility impairments or sensory impairments, et cetera, are all disproportionately impacted by any major crisis. And COVID is definitely a major crisis. We know that roughly between 1/3 and 2/3 of the fatalities tied to the coronavirus are tied to nursing homes and other congregate settings. And most times people only think that nursing homes are where aging folks live. They don't realize that there are a large number of people with disabilities that live in those residences. Additionally, those caregivers who may also provide care in other sorts of settings have also contracted COVID and died from it. And so when we're talking about the issue of the coronavirus, it has both killed people with disabilities and also at the same time created a whole new wave of people with disabilities. They're called the long haulers, which is the term being used to describe people who contract the coronavirus and it lasts for more than the 3 or 4 weeks that it typically lasts for. But these are people that have had symptoms of the virus for 5 or 6 months now, with no relief in sight, largely.
Right. So we'll have to be thinking about how to meet their needs, this new community that joins the disability community. And what other public policy issues do you see as relevant? Hey there.
We have a special guest star that has escaped from his playroom.
Hi there.
And so, when we're talking about the other issues that impact us, I mean, it's the issues impacting all Americans. We're talking about jobs right now. Our folks are the majority of low-wage workers. And so when the recession hit, it was our folks that were, most recently hired, most recently fired. We're still fighting back against the pervasive use of subminimum wage for people with disabilities. Conversations around educational equity are particularly impacting our students right now, regardless of what their disability is. Students that have 504 plans or individualized education plans may not be receiving their accommodations right now. And even as schools try to think about how to provide those services in the context of remote learning, it's hard enough for kids without disabilities, but thinking about what does that look like for families where children have disabilities or families where teachers might be disabled.
Right, for sure. Lots of important issues there to be thinking about, and thinking about, as you said, students with disabilities, sometimes multiple disabilities, right? So this year, we celebrated the 30th anniversary of the ADA. And that was really exciting, I know, for you and me, just a major milestone. And a key factor that we know in passing that bill was sort of the unity of the disability community, mental health being as protected, fully protected as other conditions. And I've been asked, and I'm sure you've been asked also, what is the relationship between the disability community and mental health conditions? And I think a lot of people asking that question think of disability as physical disability and don't see the whole array of disabilities that come under that umbrella term. Can you talk a little bit about the relationship or how you think mental health conditions fit within the disability justice movement?
Definitely. I'm really glad you brought that up. It was actually funny just a moment ago. I passed by one of my other rooms and I had a bumper sticker on the wall with a quote from Paul Wellstone. And, Paul Wellstone really was in a lot of ways the congressional champion on mental health and mental illness for so long. And he was very key in that he specifically saw it as part of the disability rights movement. And I think when we think about the crafting of the ADA, one of the things that I think was so brilliant, particularly on the definitions piece, is the fact that it's not a checklist. It talks about any mental or physical impairment that impacts your activities of daily living. I remember sitting down with a colleague of mine who's a well-known activist in the African American community, and one of the things that she said was, I have depression, but I don't consider it a disability, because she was very much stuck in that mindset that a lot of people are, based on like looking at accessible parking and seeing the symbol for disability being like a white dude in a wheelchair. And I said, okay, well, let's unpack this a bit. And I said, does it impact what you eat? And she looked at me and she said, I've been noshing off the same 2-pound bag of gummy bears like all weekend. And I was like, okay, check. And I was like, does it impact what you wear? And mind you, this was pre-COVID when we're all like wearing jeans or shorts under like our nice shirts and blouses and whatever. And she was like, I've been wearing nothing but tracksuits for like a month. And I was like, okay, does it impact how you get along with your loved ones? And she said, yeah. She's like, I haven't taken my mom's calls in a week because she keeps telling me to go to church and that's not the answer. And I paused and I said, well, welcome to the disability community because you actually fit the definition of the ADA. Those are key activities of daily living. And the fact that it impacts those pieces means that you get all the rights that come with the ADA. You get the protections around employment. You get the right to ask for reasonable accommodations in your job. And I said to her, I was like, do you ask for time? Do you ask for a schedule that allows you to see your therapist when you need to? And she was like, I can do that? And I was like, yeah, the ADA says that you can. And so I think for so many folks, so much of the imaging and the media around disability in this country really still largely frames it on physical disabilities, like apparent disabilities, things that you personally witness about somebody. And we know that that's also not the largest population of people with disabilities in this country. The largest population are people who have disabilities that we can't see.
Mm-hmm. Yeah. So, and this goes to the point that when thought leaders, foundations, policymakers, when they talk about health equity, I feel like many times the needs of people with disabilities, including mental health conditions, aren't even included as an equity issue. So I feel like this is another area that sometimes is not included where it really needs to be. Why do you think it's important to consider disability along with these other issues of equity as we talk about and think about how we generate health care that provides good outcomes for everybody?
You know, we know that disability is represented in roughly 1/3 of households. So if it's not in your house, it's in your neighbor on the left or your neighbor on the right. And so any conversation around how we create more equitable communities, and specifically equitable communities in the context of health, has to take disability into consideration. I do think one of the challenges in a lot of rubrics used that are grounded in a health equity approach is that they really approach disability as a problem that needs to be solved versus disability as part of the diversity, part of the landscape of any community. And to me, that's what makes that sort of framework fail a lot of times, or not receive or not achieve the outcomes they want to achieve, because they're not thinking about the fact that, you know, their neighbor needs home and community-based services, that, you know, their friend's child might be autistic and need speech therapy or other, you know, supports and services to be able to live and thrive in their school. They might not think about the fact that, hey, you know, they live in a community that's pretty far from a post office. It would be really great for the aging folks in the community and for the disabled folks in the community if they had a box on the corner. And what does that mean for the overall equity and the achievement of health equity for that community?
Yeah, and I mean, already you're talking about looking holistically across movements, which I know is just a hallmark of the work that you do. This is something that you are very passionate about, and it is so important. And so as you were just talking about the post office, it really got me thinking about the issue of elections, right? So we know that accessibility of voting has been a longstanding issue. You and I have been working on that for many years. Can you talk about elections and accessibility from an equity lens that is cross-movement, right? That includes disability, race, income, a lot of the things that we think are going to affect our elections.
Definitely. I mean, the ADA is 30 years old. The Government Accountability Office has been doing surveys of polling places for the last 20 years. And the percentage of polling locations that are still inaccessible has not moved from between 60 to 80%. So, you know, 60 to 80% of polling locations in this country are inaccessible for people with disabilities in one way, shape, or form. Part of that is because we also know that so many polling places in our communities are located in churches. And while churches are exempt under the ADA, because of the Help Americans Vote Act, they are required to make sure that wherever voting is an accessible place. But that might not necessarily mean access to that space. So they could have an accessible space where the polling machines are set up, but there could be stairs leading down there. It could be a very narrow hallway. It could be hard to access in any number of ways. You know, I think one of the things that's been very frustrating to me and to the disability community broadly has been the misuse of the ADA to close polling places, most notably in Native American communities, and last year in Georgia, where we saw the Secretary of State specifically use the ADA to close polling places in low-income communities and communities of color. And thank God for this, but the disability community, Georgia's ADAPT chapter, their independent living centers, among others, teamed up with African-American activists and were like, no, you're not closing polling places in these communities. We can find things that work, but we're not going to have you use one civil rights law to disenfranchise another community that even within that community has disabled people. So you can't be using, you know, it's completely mind-blowing that we live in a day where we're going to use a civil rights statute intended to protect the rights of one community to disenfranchise another.
Right. And it's interesting to hear how those communities came together and people who represented both communities talked about solutions, right? Like, how do we get to solutions? I think that's just a really important issue. And, you know, the work that you're doing is really with your initiative trying to craft solutions. So we have like an audience of thousands of people here at our virtual conference. How can the mental health community do more to advance the equity agenda? You know, how do we get to more of the solutions as we go cross movement, as we think about true justice?
You know, I think for us, it's about thinking about like who's at the table and who isn't at the table. I was talking to my team this morning. We were talking about some work we're going to be doing on making democratic institutions more inclusive. And we went through the list of like, who do we need to partner with on this? Like who in the chronic illness community, who in the mental illness community, within those spaces, who are the leaders of color, who are the LGBT folks, who are the immigrant folks, like how do we get beyond just like the perfunctory checking of the box to say whose voices aren't here, and how do we amplify those voices? How do we promote the right imaging? How do we make sure that as we're putting out language for our conference, and we lay out our values, that we talk about inclusive language, that, in the imaging that we include people with all different types of disabilities. One of the things that's been a big opportunity for me in the little people community has been pushing for AA and NA at our conferences. Because there is huge issues with substance misuse in the little person community, and it's been taboo for so long. Actually pushing to say, no, we need to have a Friends of Bill W meeting, and having people respond and be like, well, why? Like, that's not a problem. And I'm like, what conference do you go to? It's a very different, we must be at totally different places at the same hotel. But actively acknowledging like who isn't at the table and what do we need to bring them in. I also think creating safe spaces for us to dialogue across different parts of the disability movement. I was so excited when MHA reached out to CAP for us to sit down and talk, because we're really good friends and it's nice to share space with you again. And also because we should be talking. We should be talking way more frequently. We should be talking on an ongoing basis about what are the key pieces of mental health policy that we need to be pushing as a cross-movement group. And how do we help y'all connect with folks in the broader disability space, folks in the civil rights space, and really think through how do we build momentum on a lot of these things. I also think there's a huge opportunity with what Congresswoman Porter likes to call the ADA generation of Congress. The first generation of members of Congress that grew up with people with disabilities in their homes and in their communities, where we weren't pushed off in a lot of cases to institutions and sanitariums and, for my folks, freak shows and things like that, but actively growing up alongside folks with disabilities and seeing people with disabilities as valuable contributors to the work and to society.
Yeah. Can you talk a little bit about some of the issues where you see the most potential for the cross-movement building and the work that we all can do together? Are there some issues that you off the top of your mind, really feel like are some of the major ones we can be thinking about?
I mean, I think the fight for the post office is a huge issue, and it's an issue that impacts all parts of our community. Everyone uses the post office, whether it be for basic communication, whether it be for access to prescription drugs that you might have mailed to you. It's really important, I think, for people, especially in more rural communities that may live with disabilities that might not have loved ones near them. I remember talking to somebody and them saying, a person who lives with depression out in Iowa, and she said to me, she's like, Ernie's been my postman for 30 years. Ernie knows when I'm not okay because he notices the mail's piling up. And Ernie checks on me. And she said, I might not hear from anybody else for weeks, but Ernie's there like 5 days a week. And she said, and I don't know what, that's a critical part of her personal routine. And she said, I don't know what that means if Ernie's not there to check on me. And it was such an interesting point for me to think about, just in terms of like all the arguments being made around the post office issue. But for a lot of our folks that are in more rural parts of the country, for a lot of our folks that are disconnected from the internet, disconnected from loved ones, and the fact that that person is a routine person in their life is really critical. Obviously the continued fight around healthcare and increasing access to healthcare across the board, increasing high quality healthcare, high quality, inclusive, culturally responsive mental health care for everyone. It shouldn't be a luxury. It should be a standard for everybody, regardless of if you're if you're a government employee and have great insurance, if you're a public school teacher, like everyone should have access to high quality care across the board. But specifically, I mean, really making that push that Paul Wellstone really started years ago to say that like mental health care shouldn't be like a Rolex. It should be a Timex. Like everybody needs it. Like you should be able to go a few steps out your door and find a provider that gives you what you need.
Oh, absolutely. And I think during these times when, as you've talked about, doing cross-movement work, it does create trauma. People need to be able to get assistance when they need it, at all times. And so I think that another issue that, we've talked about that has cross-movement possibilities that I'd be interested in your view is on police and law enforcement involvement with people with disabilities, including mental health conditions. This is another area that we see a lot of conversation, a lot of need. Can you speak a little bit to how you see that and the intersectionalities there?
Definitely. I mean, we know that roughly 50% of the individuals killed by law enforcement are people with disabilities, and specifically people of color with disabilities. One of the challenges is we actually suspect the number is much higher than that. But the way that the data is currently collected by the Department of Justice is, in most cases, it doesn't let us cross-reference or aggregate race and disability. And within that, within disability, aggregate out mental health, aggregate out intellectual developmental disability, aggregate out deafness or other types of disabilities to really drill down and be able to be prescriptive about the kind of remedies that we need. In the conversation around the abolishment of law enforcement, I think one of the things that is very interesting in that conversation is the desire to move funding from policing and from specifically like militarization of the police to social services, increasing access to housing, increasing access to public transit, increasing access to mental health care for a lot of folks. To me, it's one of the most critical issues that impacts all of our movements. When Eric Garner said, "I can't breathe," that was a declaration of disability. He was somebody with asthma. Trayvon Martin, Tamir Rice, so many of the victims of police violence have been disabled people of color, and specifically disabled Black people. And we as a community have to have a real conversation about what that means and what that means for our community and also for the types of issues that we take up.
Mm-hmm. Yeah. And I think that linked with that, we also see that issue for children in the school to prison sort of issues that have come up in the context of COVID. And I know that's another area that you have been very vocal and active in thinking about, because, we need to think about this for our youth coming up and our children.
It really, to me, the fact that, school, it's way easier for schools to get a cop in their school than it is for schools to get a counselor is very problematic. And schools are places that kids should learn, that kids should thrive, that kids should feel safe. And instead, we continue to see just abject levels of policing of our young people, especially young people of color with disabilities. The fact that the Trump administration is still refusing to largely enforce the equity and IDEA rule, which is the rule that came out of the Obama administration that is focused on evaluating the identification, the placement, and the discipline of students of color with disabilities, including mental illness, and looking at how are some districts doing better than others? How are some districts obviously doing worse? And what should we really be looking at? If we see a district where, 50% of the students of color that have been identified as having IEPs are routinely expelled, that's a problem, and that school district is not doing something right. And what are the remedies that we need to be putting into place? I also think specifically for girls of color, it's important to acknowledge that it's not the school to prison pipeline, it's the sexual abuse to prison pipeline. And actually breaking down and having a real conversation about sexual abuse, sexual assault, and trauma, and what it means specifically for girls of color. And I say that as the mother of two African-American disabled sons and an African-American disabled daughter. Like actually breaking that down and having those conversations about those different disparities and how they look differently. And really that conversation around race and disability broadly. We see similar things in the autistic community where folks who students of color who are autistic are more likely to be identified as emotionally behaviorally disturbed, or if they're a girl, they're not likely to be identified at all.
Mm-hmm.
And so how do we actually break down and make sure that the diagnostics that are available are actually accurate for the communities we're reaching out to, and that we frame this conversation not in not in one of labeling and segregation, not saying, you know, your child is now in special ed, so they're now over there, which I think is a lot of what we do and historically schools have done, but instead say your child is being diagnosed with a disability. This comes with certain civil rights protections. Let's talk to you about that. What are the civil rights that your child has now that they can be using to, and what are the accommodations that they can be using to be successful in the long term?
Right. That idea of using this to get people the supports that they need to make sure they can be successful. You know, looking ahead, those are things that are hopeful, right? The fact that we're having these conversations, that we're thinking through these. What else, you know, gives you hope?
What else gives me hope? Talking to young people. Talking to young people with disabilities around the country about what they're working on, what they're interested in. Talking to people like Alice Wong out in the Bay Area who runs the Disability Visibility Project, who, when I first met her in the Obama administration, it was like that moment in The American President where Annette Bening thinks she's being prank called. I called her from the White House because she had submitted an email to the president, or a video to the president for Asian American Heritage Month, talking about the stigma of using home care in a traditional Chinese household. And it was this amazing video. It was so powerful. And I remember calling her and being like, "Hi, I'm calling from the Obama administration. Do you have any interest in serving the president?" And she was like, "You're kidding me, right?" And like hung up the phone. I called back and I was like, "Yes, I'm not kidding you. Yes, I'm calling from the White House. Our number shows up 202 and nothing else. So always answer my phone calls." And like, your story is really compelling and fills out a conversation in the disability community that we're not having around race and home and community-based services and stigma. It's talking to people like Alice, talking to activists on the ground, talking to activists like Dior Vargas in the mental health space, who is one of my biggest sheroes and a very dear friend, about the work that she's doing around pushing back on the stigma of mental illness in communities of color. Every time when I saw Congresswoman Ayanna Pressley take off her wig and acknowledge herself as a person living with an autoimmune disability in a video on YouTube, and not seeing shame in it, and instead saying, "I'm here to champion my brothers and sisters in this community." And I think that's the thing where, like, as we move from disability being considered so shameful and something that we hide away, to people in very visible roles actively acknowledging it and acknowledging the work that needs to be done, gives me a lot of hope.
Yeah. Well, Rebecca, thank you so much for joining us today. Talking with you always gives me a great deal of hope because of all that you're doing. And it's so important that we continue to work together. And I'm really looking forward to that. We'll take a quick break and be back shortly with Ricky Watson, Executive Director of the National Juvenile Justice Network.
Hello, I'm Karen Howard, MHA's National Advocacy Manager, and I work with our policy and advocacy teams to mobilize the Advocacy Network, which is comprised of thousands of individuals across the country who speak up and take action by either emailing, calling, or posting on social media to grab the attention of their congressional delegation on an issue or bill. We mobilize the Advocacy Network most recently on a bill to designate 988 as the suicide prevention hotline number. And we still have that action alert up on the website. You can take it now, as well as sign up for the Advocacy Network by visiting mhanational.org, clicking the Public Policy tab, and then going to Advocacy Network or Action Alerts. Thank you so much. And if you have any questions, we'd love to help you. You can email me at choward@mhanational.org.
Are you ready to shop to support mental health awareness? Our online MHA store makes it super easy. Head to store.mhanational.org today to explore our selection of t-shirts, pins, stickers, jewelry, and more. Right now, we're offering 15% off your total purchase for all conference attendees. Just use code CONFERENCE2020 at checkout. This makes it the perfect time to grab your favorite products and share the message of hope and healing. 100% of sales support our programs here at MHA, including screening, public education, and advocacy. Have fun shopping!
As the nation's leading mental health advocacy organization, MHA covers a lot of ground. We are about all of prevention, early identification and intervention, health, education, and social services integration, and intervening before stage 4 is the key. And as it is with every condition, recovery should always be our goal, even when cures are not yet possible. But for too many people, what passes as early identification and intervention is the first time a child engages with the juvenile justice system. That engagement is pretty common for kids with serious mental health concerns, that have usually already been untreated for years. And let's be honest, it is even more common for Black kids. We can do much better than that. And we are joined now by someone who's on the front lines of helping us figure out how. I want to welcome Ricky Watson, Executive Director of the Juvenile Justice Network. Ricky joined NJJN as its new Executive Director earlier this year on January 2nd. As an alum of the Youth Justice Leadership Institute, he's ready to help NJJN move into the next phase of development as an anti-racist organization and one that centers the voices of those most impacted by the injustices of the youth legal system. Ricky earned his JD from Elon University School of Law and his BA in Political Science from Wake Forest University. He began his professional career as an assistant public defender for the Guilford County Public Defender's Office in Greensboro, North Carolina, where he represented hundreds of indigent adults and juveniles charged with misdemeanors and felonies. Prior to joining NJJN, Ricky was the regional manager for the Vera Institute Center on Immigration Justice Unaccompanied Children program. And before that, he served as the co-director of NJJN's North Carolina member organization, the Youth Justice Project of the Southern Coalition for Social Justice, where he advocated for policy changes to disrupt the cradle to prison pipeline. Welcome, Ricky.
Thank you for having me. It's really nice to be here.
Great. Can you start by telling us a little more about NJJN, your mission and goals?
Yeah, absolutely. Our goals and our mission, is ultimately to reimagine what juvenile justice looks like. We're a membership-based organization of about 56 to 58 different members right now and actively growing. And justice looks different in every community. And ultimately what we do is serve as a national presence to connect all of these advocates across the country, to support and facilitate the work, and to create a space for, and particularly with the Youth Justice Leadership Institute, create a space where advocates can rely on one another and just build community. We're a large network, we're a mighty network, and we really believe in the work that we're all doing.
What are the key issues that are emerging these days, and have they changed in the course of this year?
Yeah, I mean, it would be hard to talk about any of the work that we're doing right now without discussing COVID-19. COVID has really brought to light a lot of the issues that many advocates have been talking about and discussing for years at this point. When we speak about the need to bring resources to communities, to bring opportunities to communities, and to remove, the presence of over-policing in communities, that's what this defund police is really referring to, right? Clearly, the needs of young people in this moment, in this country, and the cries and calls for racial justice, these are all things that, as an anti-racist organization like the National Juvenile Justice Network and all of our members have been screaming. And we're happy to see people finally joining in that are new allies and new advocates. And we're really looking forward to being able to capitalize on this moment. Obviously, a lot of situations have been really tragic. We lost the life of a young boy in a facility in Michigan just a few months ago, around the same time that George Floyd was murdered. He screamed out the same exact phrase of "I can't breathe" when he was held in a facility and restrained by some staff members at a PRTF. So, we think that this is really, while it's obviously very, hard and challenging right now, we think that this is really a moment that we can capitalize on a lot of the restorative practices and the, trauma-informed care-based practices that we really want to see in our communities and with the young people that we're trying to advocate for, and the young people that are advocating for themselves.
Was that young man Cornelius Frederick, or is that somebody else? And I don't think most of our attendees know much about him, but they should. Could you share a little more about his life? Yeah, so we've worked really closely with our Michigan member on this case. Cornelius Fredericks was a young man who, had ultimately become a ward of the state. He was in and out of different facilities and unfortunately found himself at Lakeside Academy, which is a facility that's ultimately operated by a for-profit corporation called Sequel Youth and Family Services. This young man was gotten into some sort of an incident where he threw a sandwich and was restrained by
the staff members at this facility, and he was restrained to the point where he stopped breathing and ultimately died. Unfortunately, we believe that there are a series of things that could have been done to, prevent this, but ultimately we want to highlight the fact that, situations like that occur in facilities all the time, and, maybe they don't rise to obviously the tragic death of a child, but ultimately, there are a lot of other egregious incidents that occur in these facilities, and we really want to shine light on that. So that's certainly been one of the pieces of work that our organization has been doing, and working very, very closely with members across the country to kind of figure out some solutions to really eliminating for-profit facilities, specifically PRTFs.
So what about you? What motivated you to do this particular work?
Yeah, it's funny. I actually was back at my parents' house this past weekend, and as you get older, you have to go and clean out the things that have been stuck in your parents' house over the years. And I came across an article that I'd written.
By the way, you don't seem that much older to me. So
it's funny.
It's all relative.
I found an article that I had written back in high school that talked about racial disparities in school systems in my local county. So I've been doing this work for quite some time, and to talk a little bit more about the mental health aspects of the work that I've done in my past. I started out being introduced to mental health on a very personal level of having several family members with some mental health issues, and more specifically, I actually had to visit my sister in a facility when I was a young kid, and I remember visiting her. This was a behavioral health center in Greensboro, which is the city that I'm from. And it's everything is full circle because, after passing the bar, after becoming a lawyer, and in my earliest years of practice, after a couple of years actually of practice, I began doing some civil and involuntary commitment work as a public defender, and specifically in juvenile court. So I did that work for adults and children, but I actually ended up in the same facility visiting clients at the same facility that my sister was actually in at a certain point in time in her life.
So why do you think it is that we've been so quick to move young people with mental health conditions into systems of care? And sometimes we use the term loosely like this.
Yeah, I think that's a great question. Clearly, it really comes down to this. It comes down to resources. At the end of the day, our society has chosen to invest in, over-policing our citizens. And of course, that also includes children and young people. We would rather see, a movement towards putting resources in communities so that people don't have to interact with police, and that they don't have to, be handled by a system. Very often in my court experience, young people would come in and would be accused of minor things for the most part that didn't really rise or need to be addressed in court, but it was one of the easiest ways to ensure that a kid that needed services or resources was given the opportunity to have those resources. And what that comes down to is the lack of those types of opportunities and services being in the community and being accessible for people in communities. So when we talk about the racial disparities, and we talk about the risk factors for developing a mental illness, we have to talk about poverty. We have to talk about the exposure to environmental toxins when people don't have clean water, right? We have to talk about the stress related to chronic discrimination in this country. And we also have to talk about the loss of close relationships and witnessing violence, and ultimately what that is trauma, right? So at the end of the day, there are a variety of factors that have led to kind of this critical mass of a crisis in mental health in this country, but we have to figure out a way to really think about strategically where we're putting resources and what we're doing in terms of how we're allowing people to access those resources.
I couldn't agree more. And obviously, that's a big part of the mission of Mental Health America, too. So many people try to reframe prevention, reframe early identification, reframe earlier interventions around taking people and moving them outside of the juvenile justice system and then later on the adult justice system, which seems to me to be awfully back-end oriented. It's awfully late in the game. And, you point out that, if we're looking at community level, we're looking at things like trauma. We're looking at things like, neighborhood violence. We're looking at things that we subject people to as a matter of policy. They're very different. And if we address those concerns, we wouldn't just be addressing these public safety concerns down the road and these mental health concerns. We'd actually be improving the overall health and well-being of the population too.
That's right. That's absolutely right. I mean, when you talk about the numbers in terms of juvenile justice, I don't love to talk about numbers, but they're really important and they tell a story if used well. 70% of young people, who come into contact with the juvenile justice system have a diagnosable mental health disorder. It's not very different if you really, ever spent any time in a courthouse with adults and spent time in a jail, to know that some of those stats are very similar when it comes to adult folks. And if we as a society could choose to prioritize and value, mental health in this country, we could avoid a lot of the issues that we see in terms of crime. We criminalize poverty, right? We criminalize people not having places to go or places to sleep, when at the end of the day, people need resources. People need to be able to eat. They need their basic needs taken care of. And mental health is a part of that. Over 60% of young people, with a mental health disorder have a substance abuse disorder. So we're talking about addiction issues. We're talking about exposure to different things at very early ages that creates these dependencies on chemicals. So these are all factors that need to be considered and really need to be discussed, both at the community level and at the state level and at the federal level, to ensure that, again, we can bring those resources. And when I say resources, a big part of that is ultimately just dollars into the right hands, into the right communities to provide for services without having to require a kid to become involved in the juvenile justice system to make that happen.
Yeah, it seems like for the last 40 years, maybe, we're not supposed to talk about dollars. We're not supposed to talk about money. People can couch it, will couch it in terms of investments in our future, because the bottom line is, the minute somebody says you got to spend more to do this up front, then somebody else comes back and says, yes, but all those taxpayers are, aren't going to want to pay more, aren't going to want to pay more for this. I think that sometimes they miss the point that, we're paying the dollars, and people know we're paying the dollars, and we're paying them in places we don't want to be spending them. And we're spending a lot of them in those places, like jails and juvenile justice centers, juvenile detention centers, adult detention centers, even custodial care institutions. I think that, I sometimes, sit back and say, well, why? Why is this that we're not, putting a lot less in overall by putting a lot more in up front? But the reality is it does boil down to it being just that simple, that we can't be afraid to just ask for more money for this stuff, to ask for more money to improve a lot of people, everybody.
I think that's right. I think that, it always has to be money plus. Even in educational law and children's law, we find that it's not always just about the allocations of dollars, because sometimes just increasing money isn't enough. What we need is money plus the lens of racial equity and anti-racism. We need a lens that recognizes and acknowledges that we're dealing with systems that are intrinsically tied and connected to this country's issues with capitalism and slavery and racism. So if we don't have that analysis when we bring ourselves to this work, I think really, I think unfortunately we're going to miss the mark. You can flood the dollars in there, but you're not going to be putting them in the right places with the right level of analysis. So I think that it's really important that we really talk about the disparities that exist, the racial disparities, and the fact that so many Black children and children of color have to deal with so many additional burdens that really only contribute to mental health issues.
Yeah, I think you're so right about that. And if people think that, we just throw more money into a system that is already segregated, or a system that already denies care to people, a system that is already, built on a racist principle, that we're not going to achieve the goal of social equity. We're not going to achieve the goal of making certain that everybody advances, and so, as some would say, all boats are lifted. And but again, that of course shouldn't be an excuse, and it's been made an excuse, I think, for people to say, well, then we shouldn't spend any money at all. First, we have to fix this, and then we can go about the business of spending money. I think it kind of needs to be in reverse. We need to literally invest money in anti-racist systems, and when it comes time to tear down some of those, that and I'm a big fan of moving money. When people say, you want money in the mental health system, where's it going to come from? You're asking for billions and billions of dollars. I'm a big fan of saying, look, take it from the jails and the prisons. I mean, I don't want that system. And I know that one's built, and stacked against certain people. So I do think we can hold both thoughts at the same time. Don't you think? I mean, we can get policymakers to understand that you've got to spend more, but you've also got to take it away from certain places that aren't doing anybody any good.
That's right. I think we can walk and chew gum. I'd like to think. At the end of the day, these systems build themselves, right? They have been built by people. They maintain themselves, and I think ultimately, when you create a system that relies on literally bodies in beds, in cells, it's dependent upon it keeping on going, right? So we need to incarcerate. We need to do that. But I think that if people reimagine what it looks like, and if we begin to shrink those criminal systems, and again, reallocate these funds, reallocate these resources into places where, maybe we don't need a 1,000-person jail because we created a facility or some sort of community-based program that allows for, the 30 people or 40 people that might have mental health issues, they have some sort of resources to address those issues. Unfortunately, I know that in certain times of the year, people will figure out a way to commit a crime to find a place to sleep, or have a hot meal. And we ultimately really need to be dealing with and addressing those things before just continuing to build up the system that really kind of just eats itself and eats off of other people.
I really appreciate that. And I think your perspective is right on. I think that, I'm excited about the work that you're doing. You give me a lot of hope for the way we can move forward. I think you've got the perspective that I'm glad we're able to provide a platform for you to share. I think it's a far broader perspective than maybe people would have thought in looking at, they're going to do a session right now about juvenile justice and how narrowly focused is that going to be. So I just really want to thank you, basically, for the work that you're doing, and thank you for spending this time with us today. Do you have any final thoughts that you'd like to share about what it is, if there's something out there that I haven't asked you about, or something that we ought to be doing that we just haven't thought to do yet to work more collaboratively forward in the future?
Yeah, I think I'll leave folks with this. In the midst of this pandemic that we're dealing with and that we're facing in this country, the young people that are behind the walls of these facilities are really at even greater risk than they've ever been. They're subject to dealing with isolation and being, completely away from their families and removed from the ability to even, physically be in the same space with them. We also have to address and recognize that there is a huge technology gap that doesn't even allow for those families to necessarily always be able to virtually be in community with their children like we are right now. Service suspensions are across the country, happening as a result of this pandemic. Use of solitary confinement is also an issue that, we as advocates are concerned about, whether it's, medical isolation or if it's solitary confinement as a result of kids having, to deal with the trauma and stress of being in these situations. And then obviously, there are limitations with staffing right now as a result of the pandemic and just people trying to generally avoid that physical contact and proximity to other people. I think we really need to be thinking about ways to, make sure we're protecting our kids. But just to talk a little bit about what you said with the broadness of this conversation, juvenile justice is criminal justice, but it's also about our values as a society. If we aren't taking care of young people, if we aren't taking care of those that are most vulnerable, then we'll be worse off as a society, and we won't have anybody to take care of us when we're old and gray. So we really need to invest in young people. We need to invest in new systems and new opportunities that allow for young people to lead the way. My organization had a forum a few months ago, and we invited young people with expertise and experience in dealing with the mental health systems that they found themselves in. We gave them a platform to speak, and we want more of that. So if you all know of young people that are aware and working to do different things to change the systems that they find themselves in, please send them to National Juvenile Justice Network, and we'd love to work with them. So with that being said, I really appreciate your time and this opportunity, and keep up the good work.
Well, I think all of those points are important ones, and I'm really glad that you've made them. And, we have a large, young constituency. So many of the people who come to us for mental health services will overlap with the people that you're serving, because these are diseases of childhood, half of mental illnesses emerging by the age of 14, 3/4 by the age of 25. So we do have youth groups. We have featured some young people at this particular conference, and as we have in our past few conferences too, and we'll continue to do that in the future. So I think this is going to be an avenue where we can work together, and it's so critically important, as you say, because we can't keep accepting the fact that at the back end, people are wondering about, how do we get 40-year-olds out of jail and out of the revolving door of homelessness and incarceration, when the answer is that we're the ones who started them there, back when they were 10 or 15 years old. And so the work you're doing matters, and it's making a difference, and we're looking forward to working hand in hand with you as we move forward. Thank you so much, Ricky, for joining us today. We'll be right back.
Hi, I'm Kevin Rushton, Program Manager of Digital Solutions at Mental Health America. My main project is Screening to Supports, an online platform where we connect people who take our mental health screens with the resources that will help them the most. This includes information about mental health, referrals to treatment services, do-it-yourself tools such as apps and worksheets, and ways to connect with peers online. If you have a resource that you think belongs on Screening to Supports, please contact me at krushton@mhanational.org.
Hi, I'm Kelly Davis, Director of Peer Advocacy, Supports and Services at Mental Health America. And at MHA, I work on our National Certified Peer Specialist certification. The NCPS allows peers from across the country to demonstrate an exceptional level of skills, knowledge, and experience in the field of peer support. It also guarantees payers, providers, and employers that they're getting the same quality service no matter where they are in the country. To learn more, head to nationalpeerspecialist.org or email me at kdavis@mhanational.org. All right, welcome back, everybody. For those just joining, I'm Kelly Davis. I use she, her pronouns, and I am the Director of Peer Advocacy, Supports and Services at MHA. And I really focus all of my work on the power of lived experience as a means to transform mental health and mental health services. And one of the most awesome things I get to do, among all the great things I get to do at MHA, is working with our Collegiate Mental Health Innovation Council. So CMIC was launched in 2017. and it was developed to highlight student-led programs that fill gaps in traditional mental health services and supports on campus. There's been a lot of attention paid to the growing campus mental health crisis. Young people are really having a hard time. And, in my experience as a college mental health advocate, I found that, people were willing to listen to me talk about my distress maybe, but they weren't willing to listen to me talk about the things that I thought should be done to change it. And that's an experience that many young people have across the country, where they feel like I have awesome ideas about how to impact my community. I don't really know how to get started, and I don't know where to go. And CMIC was really designed to find students who were doing that work, who created cool things, and to highlight their voices, but also their programs. So CMIC meets every year. There's members who are selected from across the country. We have monthly meetings to discuss the major challenges and solutions that they see in mental health, to share their knowledge and experience to the broader MHA network, and also to develop an annual report highlighting trends and their perspectives as students. So what do they see as the major issues and challenges for them and their peers, but also to highlight their work. So the report is a highlight about the young people and college students' lived experience on campus, but it's also a guide on, how they got started with their program, what are some issues you might run in doing something similar, and how can you get in contact with this person directly to help build something similar on your experience. Because so often many students who are doing advocacy are kind of dismissed or pushed aside, or their universities say that's a liability, we can't do that, we know what's best for you. And students can say, actually, no, this is a great idea, and here are students who already did it, and I'm actually in discussion with them, and here's how we can do it here. So today I am pleased to have several of our phenomenal CMIC members with us to talk about their programs, their backgrounds, and how they've worked to find new ways to fill gaps in traditional mental health services and supports on their campus. So with us today, we have Juan Acosta, Ananya Cletus, Marissa Hauderschelt, Joy Michelle Rhodes, and Braden Renke. We're missing Shivani Nishar, who is an amazing advocate, but is a recent graduate and is at work, so could not join us today. So I wanted to kick it off by letting everybody share a little bit about themselves, their story, and their work. And then we're just going to have a conversation about, we've heard about disability justice, about the voices of lived experience, but what does it look like to move beyond listening to people's stories to taking action on their ideas, and not just integrating them, but promoting them, highlighting them, and supporting them with money and power. So I'll get started in our intros. I'll kick it off to Juan to share a little bit about the advocacy he's been doing for a long time.
Thank you so much. I'm Juan Acosta. I'm 23 years old. I was born in Jalisco, Mexico, and I grew up in Woodland, California. I attended San Francisco State University, in which I served as assistant director of the Queer Alliance Club. For me, it was really important to focus on creating a true and real safe space, as I like to say. Oftentimes college students are trying to obtain resources but don't know where to go. And in many classrooms, they find posters that say this is a safe space, but there's no accountability to ensuring that that space is actually safe for the student. Prior to starting San Francisco State, I was at a community college in my hometown. Growing up, for me, it was difficult, and I started my mental health advocacy because of my own struggles. My own struggles were a catalyst for me to get involved in this work, and it was important for me to change a lot of things that I felt like I needed when I was growing up. So I drafted a historic LGBTQ+ proclamation for my hometown that passed for the very first time in the town's history, and the town is much more older than I am, so it was great for me to be a part of that moment because I needed that when I grew up. And it's a lot of bravery to speak up and share your own lived experience oftentimes. And that's why I'm so proud to be here with all my fellow committee members, because they all do amazing work as well. I also served in a committee for California's Mental Health Services Oversight and Accountability Commission, in which we hosted the first of its kind regional innovation idea labs throughout the state of California with other amazing committee members as well.
Awesome. Thanks, Juan. And I'll kick it over to Ananya.
Hey, I'm Ananya. I'm 23 and I'm a senior in computer science at the University of Illinois, Urbana-Champaign. I was actually born in New Delhi, but I've spent most of my life growing up in Pittsburgh, Pennsylvania. And the reason I kind of got involved in mental health advocacy was through my own lived experiences as well. Growing up, mental health was something that was very, very stigmatized in the Indian American community, as it is in a lot of other communities, and I never really felt that I could talk about it or get support while I was growing up. And once I went to college, things started to get a little bit worse for me, and I ended up having to leave university for almost 2 years to take a break to focus on my mental health. And that was sort of where I think my passion for mental health advocacy really kicked off. And I was invited back to give a TED Talk at my university and share my story with other students. And I realized that a lot of other people had similar experiences, not only with dealing with stigma within their different cultural communities, but also dealing with issues with faculty training, lack of faculty compassion, and a lot of issues around mental health crisis response. That was something that I had lived through a lot as well. And it's something that I think continues to be an issue on university campuses. So that inspired me to create an app, Anemone, which is basically a mental health crisis app for everybody to basically create a crisis plan and then also have access to resources in their community, national resources, coping skills, and a virtual grounding box. So the idea behind that is just that no matter where you are, whether you're a student or anyone, you'll have access to those crisis tools. And that was something that I think was really lacking on my college campus. In addition to that, I've also been involved in a lot of mental health advocacy, specifically in the engineering and STEM space, because I think that's a really difficult climate because a lot of prestige is often related to rigor and how much students struggle. So that's something that I've been involved in terms of different projects like getting a syllabus statement, getting mental health resources published online for students, faculty training, mental health awareness events, that kind of thing. And it's been a long journey, but I'm really excited that I've been able to be back and really happy to be a part of this committee with everyone.
Thanks, Ananya. We're all great that you're here. We're grateful that you're here. And I will turn it over next to Marissa.
Thank you, Kelly and Ananya. So my name is Marissa. I'm a queer, non-binary, first-generation college student. My preferred gender pronouns are they, them. I am a fourth-year public policy major education minor at the University of California, Riverside, and I live with bipolar II disorder. I grew up in the Inland Empire of Southern California, born and raised. I wanted to stay here within college because I felt that there was a need for folks to invest in the Inland Empire community, both with mental health services and just broader social services in general. So prior to the council in the 2018-2019 school year, I was involved with Lobby Corps, which is a program in our external office in the student government. And in that organization, we lobbied local, state, and federal officials on student-centered bills. Some of the work that I did specifically was on advocating for more funding for mental health services on campus. In the University of California system, we do have a quite large student population, and most of our psychological services are overpopulated and underfunded. So that is something that I wanted to make sure that stakeholders knew that this is an issue and we need to address it and we both need to fund it. So when joining the council, I was truly empowered by everyone else here and the great work that they are doing. And it really encouraged me to, look into what more can I do on my campus. Through this council, I was able to analyze leave of absence policies because, as Ananya had stated, it was something that I also had to go through. When you're a college student and you're facing mental health issues, it's really hard to keep up with your workload. And for me, it was something that I needed to do to save myself and my mental health. So I feel like student-centered leave of absence policies can definitely be life-saving. It was life-saving for me, and I wanted to look more into that and see how it was on the UC system-wide. So yeah, I really enjoyed this time in the council, and it really helped me recognize the injustice and ableism that we see within higher education institutions.
Thanks, Marissa. Totally, totally agree. And we'll talk a little bit more about what it means to be student-centered later, but I'm going to turn it over to Joy to share a little bit about you and your work with Fight Club.
Hi everyone, my name is Joy Rhodes. I am 22 years old. I was born in Memphis, Tennessee, but I have lived in Tulsa, Oklahoma for the past 4 years. I recently graduated from Oral Roberts University here in Tulsa with my bachelor's in social work. I really got into advocacy because as a freshman coming into college, I have lived experience with chronic depression, borderline personality disorder, and anorexia. And so when I first got on campus, I really had no idea how to surround myself with the services that I needed to succeed. And I really just thought maybe I just need to keep seeing my therapist and I'll be fine. But little did I know I needed a lot more than that. And so like a lot of my other peers have mentioned, my freshman year in the spring, I ended up having to take a leave of absence. Unfortunately for me, that was kind of a forced decision on the administration's part. And taking a leave of absence was not necessarily in my best interest at the time because I definitely did have more support at school than I did have in my home environment. And so it was unfortunate that I had to leave and not really have as much support at home. But when I returned my sophomore year, I kind of just thought like, hey, that situation was pretty unacceptable and I need to figure out how students can be protected because I know that I have more rights than what was upheld during that situation. And so I really just started to have conversations with other students on campus because I knew that I couldn't possibly be the only one who had felt that way. And I started to hear similar stories about other students who had been forced to take leaves of absences. And I just really started to talk to my peers about it and decided where to start. And so what I noticed was that with our student counseling services, we only had 2 counselors on staff, and I had been hearing from other students that they had been on wait lists for almost an entire semester, sometimes 4 to 5 months to see a therapist. And I really thought that that was completely unacceptable and that when students request services, they should be granted the services they need when they ask for them, because I know it takes a lot of strength to reach out the first time and some people might not reach out a second time if waitlisted. And so I started a petition to our university president, kind of highlighting the need and needing to meet the demand for therapy on campus. And within about a week, it got 1,000 signatures, really started a conversation and caught the attention of our president. He got a committee together and decided that he was going to build us a brand new counseling center and hire new counselors. And so I was really thrilled that I was able to help amplify the student voice and letting the administration know that we had a need and that our tuition money should go towards protecting student health. Along with that, as Kelly mentioned, I started a group called Fight Club, which was ORU's first student-led peer mental health psychoeducation support group. I go to a very small Christian university, and so they often try to control the narrative on how students view mental health. And so this was the first time students really had a place where they could talk about their struggles and support each other and get the education that they needed on mental health issues. So I'm really glad that I was able to create that space for students on my campus.
Awesome. Thanks, Joy. And last but not least, turn it over to Brayden to introduce herself.
Hi, everyone. My name is Brayden Ranke, and I'm a junior at Franklin and Marshall College. I guess you could say I started with my advocacy work because in 2018, my father committed suicide, and that really changed my life. My dad struggled with chronic traumatic encephalopathy, which basically has similar deterioration of your brain as Alzheimer's, things like that. So once that happened in my life completely changed. I really became really passionate about mental health and how I could help other people. And I almost found that to be my outlet to this whole entire situation that I've been dealing with, because through helping others, I've been able to help myself and find the resources that I need for myself. I created the Pizza Project a little over a year ago, and that has been such an awesome experience, and I'm so excited to announce that as of literally yesterday, it is now an official, organized, recognized organization on my campus, and we will now be getting funding through our campus which I'm so excited about. The pizza aspect kind of comes in because my dad owned a pizzeria. He opened it when he was 18 years old. He actually missed school that day to open up his pizzeria, and asked the lawyer for a note so that he would get excused. So pizza was kind of something that was always a part of my life. My dad would literally close down the pizzeria I played sports in high school. So for pasta dinners the night before dinner, before games, my whole team would go in there and we'd eat pizza with him, or he'd donate to churches, to temples, to schools, other sports teams, bands, you name it, he donated, the hospital. So I really wanted to create an organization that could not only, continue my dad's legacy and give back to the community like he did, but also to create something that could help educate people on resources. Because after everything that happened in my life, I didn't know really necessarily where to look, who to talk to. Figuring out who I was comfortable talking with was a whole other struggle. So really creating an organization that makes mental health resources easy to find and very accessible. So the Pizza Project, we put together a website, myself and some other peers on my campus that I'm so thankful for helping me set this up. We basically have been talking to different student organizations on campus and asking, what do you think you might need as a resource, or what have you found helpful? And it's basically a website that lists all these resources, and then we've posted QR codes around campus so that people could easily access them by just scanning the QR code and then going away. Because some people don't feel comfortable reading, mental health posters in front of others. This kind of, works on breaking the stigma, but also makes an environment where people are comfortable, getting the resources without, being seen in front of some poster. Also, the pizza aspect of this, we hold bi-weekly free pizza giveaways, which has actually created an environment where people feel comfortable to come up and talk to me about different things that they're struggling with, how they can get involved, sharing resources. And there isn't one college kid that doesn't like free food. So that's been a really great way to bring people in. And also, in the picture in the beginning, I don't know if you saw it, but that's my dog Sandy. She comes to school with me, and Sandy also attends these free pizza giveaways. So that's another thing, free pizza and petting dogs. Great way to get people in. So yeah, that's about the Pizza Project. And lastly, I'd just like to say I'm really thankful to be a part of this group. Kelly has helped me tremendously. All of my other peers on this council, thank you so much for everything you've done.
Thank you all. It's, so excited everyone's got to hear a little bit about your stories. And I think going off of something Joy said, and I kind of got at this in the beginning, there's a large movement, excitingly, to listen to the stories and experiences of young people. But often, they'll say, oh, we'll bring a young person on this panel, or we'll put a young person on our council. But we're not necessarily committed and invested to doing things differently and actually listening to and implementing their ideas. So for folks who are listening out there, we want storytelling to be important. We want people to share their experiences, but storytelling isn't the end, right? Something's supposed to come after storytelling. So what has it been like for you all to actually say, you know what, yes, I'm going to step up and tell my story, but I'm going to create something different too. What has it been like? What was it like to step up and take initiative on your campus, and what was that experience like for you? And I'll start it off with Juan again.
For me personally, well, I've encountered that, and it's something that, I like to call it tokenism, when you're asked to share your story and be vulnerable and be at your most brave moment, sharing past trauma or past experiences that really hit home to you, but they're not being accountable for what comes after, right? And for me, it's always been important to be intentional in the work that I do, but also expect that from the people that I work with or for. And I feel like oftentimes there's this misconception that the youth or young people can't lead. But what I've seen is like with my peers here and outside of it is that young people are leading, especially in this moment. And we are all going through this moment collectively, but I feel like it presents us with an opportunity to be more intentional about it. People are struggling with their mental health. It's no news for anyone. We know that. So now that we know that, what are we going to do to change the system? We can no longer be providing youth with resources without asking them what they need, because then it's just an offer, but does it truly serve them if you're not asking them for their opinion and perspectives? And that's why being a part of that committee for the state's mental health commission was truly valuable to me, because for one, I was able to bring youth and other leaders together to have a collaborative conversation that really ensured that they were communicating. We can't have people speak at us anymore, nor hand things to us after they've already been completed. It's important to gather that perspective and that lived experience to make things truly work and function for all and not just some.
I definitely agree with that. On my end, like I had mentioned before, something that I did was, make stakeholders know that, there's a need for funding of mental health services on our campuses. I don't think it's fair for them to, admit students that are from marginalized communities and not have the resources or means to, truly let them thrive. We really have to start questioning, why is it that, students have this, broke college student trope? Like, why is it? Why are we struggling with housing and food insecurity? We really have to start questioning that, and we really have to start holding these institutions accountable, because at the end of the day, we are here to learn, but we are also paying for tuition. And yes, it does take a lot of bravery and courage for us to stand up for ourselves, but we don't have to be the only ones doing this work.
I agree completely. Oh, sorry.
Oh, it's okay.
I agree completely with that, because I think something that gets glossed over so often is the fact that you can't get the youth perspective without the youth. And exactly like what you mentioned earlier, like the idea of having a council where there's one young student on the council, I think really defeats the whole point. And so something that I think has been really, really helpful in getting that perspective out there, honestly, is strength in numbers, sort of what Joy was talking about with getting a lot of support on the survey, I think that she said she put out. But basically just finding people around you who are willing to rally with you, and you're willing to elevate their voices and find a place to actually meet with not only faculty, but also administration, because I think there's typically a disconnect between both of them and the actual student needs. That's definitely something that I've seen at my university. But just getting that group of people together who, are willing to go on this, willing to talk about this, willing to share their experiences. Because everywhere you look, you'll find these experiences, whether people are posting memes online or, posting on Reddit or just telling you their stories. This is definitely something that a lot of people go through. But sometimes you need that whole group to give people the strength to come forward and give people the strength to share their story. And I think that has been really helpful in getting faculty to listen to us and getting administration to listen.
I agree with Ananya and Marissa. Like they said, I think it's important for us to stress to administrators that students are the experts on student mental health, not administrations. And really for me, especially on my campus, it's just been about, I really value authenticity. It's been about calling out hypocrisy. And if there's a university that wants to boast about how great they are, but they're ignoring student mental health, I'm going to want to call that out. If you have a president who says that we value our students' mental health, and for me, particularly at a Christian campus, who does a chapel sermon about depression and how we support people, but we're spending money on a new athletic complex and not into our student mental health services, well, I'm going to have a problem with that. And as an advocate, I'm going to say something about it. And so I think it's really all about channeling that kind of righteous indignation that I think we all share as advocates for when we see something that we have a problem with, and speaking out. And that will remind other students that, hey, like, I have a voice too, and I also have a problem with this, which means that I can say something about it as well.
I couldn't agree more with what all of you have said. just kind of my whole initiative, the Pizza Project, goes from a student perspective, because that's basically something that all of you have stated in this, is that, students are the ones that are going through this. Students are the ones that are dealing with these issues. And by polling other students and asking them what they find, that have helped them or what they might need, that's really important, because, at an administrative level, kind of again, what you guys have said, but, blank statements have been thrown out saying, we care about student mental health, or here are some resources. And, not all the time they're not the greatest, or those, statements feel kind of empty. So I really think it's important, while it's, definitely a burden on the student, I think it's really important for the student to get in there, be a little bit vulnerable, share their voice, but also, by doing that, getting other students inspired to do the same thing and really help other students find their voices. And again, strengthen numbers. I've seen that at my campus. One person, feels vulnerable, shares it, more people jump in. And that strength in numbers, I think, is really what changes things on campus.
So I guess it sounds like what you've all mentioned, strength in numbers. For folks who are listening, and for young people in particular who are listening, what are some strategies or some things that have worked for you all around bringing people together, around activating and mobilizing other young people? I'll start off with you, Joy, because you so quickly got so many people to sign on to your initiative. How did you do that, and what would you recommend for other young people looking to do something similar?
Right. Well, I will say as a caveat, I go to a very small school of about 4,000 people. But regardless, I found that it really was just about talking to the person that I see in the library, talking to a friend, and really about, I'm such a big supporter of self-disclosure and vulnerability. And if you're talking to a student and they're struggling with something and you can relate to it, say that you relate. Say, yeah, I struggle with depression too, or there was a time in my life where I was suicidal. And it shows people that, like, hey, she's talking about this and it's okay for me to talk about it. And then everyone realizes it's okay for us to talk about this. And social media has also been a big outlet when I was passing around the petition, reaching out to close friends and just encouraging them, because I realized that what I wanted to say with my petition was what thousands of students on campus had been thinking but had been afraid to say the whole time. And so, like, a lot of my peers have said, like, as an advocate, once you step up and say it, I promise you there will be other students who are just waiting to step up and to join you and really rally around that cause for sure.
I think
Go ahead.
I think the transparency is such a big piece of that, and I'm really glad you said that, because that's something that I've seen on my campus as well, is that I think just by virtue, mental illness makes everyone feel like they're alone, when in reality, people aren't alone at all, but it takes the first person to sort of go forward and say, like, hey, I've been through this as well. These are some of my experiences. And even though that's extremely hard and terrifying, as an advocate, to start off by being so open about your story, you'll be surprised how much it empowers other people around you to also be open about their story. And so I think that definitely is the first piece, is really putting yourself out there and letting people know that it is okay for them to also speak up about what they've been through. And everyone's experience is completely valid, but you'd be surprised how many people have such similar experiences but just didn't realize that they did have such similar experiences.
I would say in the beginning of, after losing my dad and everything, I was kind of in the mindset of, I don't want anyone to know what happened. I don't want anyone to know what's going on with me. I want to kind of cover this up because I don't feel comfortable being vulnerable. But after time went on, a couple months, I really noticed, these things on campus and these things in my community where I just was like, this is not acceptable. Mental health resources need to be there. Students need to know what's accessible to them, because I know I can't be the only one struggling. There has to be other people struggling as well. And by being that advocate, stepping up and being that person to, put your story out there, while it may make you uncomfortable, the amount of people that, you might never expect to be dealing with anything, because every day they put on a brave face and, are the most confident person in your class, or, the star athlete or someone that's an amazing musician, you might think, oh, they have it all figured out. They have it all together. Everyone's dealing with something no matter where you come from or what you look like or, anything. So I think, being that advocate, it really, as what you guys have said, it helps people feel comfortable to talk to you, and being relatable, and putting your story out there just really like has other students come out, which has been a great step at Franklin and Marshall. So many people have been coming out now that, I put the pizza project out and other movements on campus, again, kind of linking back to the strength in numbers, really just getting out there and being, brave and putting yourself on the line, essentially, really has helped other people tremendously.
I agree with everything that y'all have said. Definitely, it's something as simple as organizing like-minded folks. It's okay to start small. A lot of times when people think about starting something, they end up, discrediting the power of their voice and their own lived experiences and their narrative. Just like y'all have said, it's about really empowering yourself and empowering others to, speak up about their lived experiences and what they have gone through. And something that Joy had mentioned, definitely don't underestimate social media. It's definitely a source that we all use, we're all engaged with. It's an outlet where we can both educate others and, discuss stuff that is going on in our personal lives. You can definitely use it to transform into a healing place. I know that it can definitely go both sides of social media, as it can be toxic, but you have the ability to transform it into a healing space. And one last point is, learn how to work in a team and depend on trust on others. I promise you that you are not the only one going through something. There is always someone else going through the exact same thing or something very similar. It definitely does take a lot of bravery to speak out, and y'all should definitely recognize that, but just know that you are never alone.
I'd like to echo everything everyone else said. It all kind of circles back to stigma and leadership. The stigma of speaking up and of these conversations, many different cultures or other spaces, but that's where the leadership aspect comes in. If one person is able to speak up, and this is the mindset that I take in when I do the speaking engagement or when I try to talk to someone to join a certain committee or council, it's about them really identifying with maybe your path or your story that they might not be able to see elsewhere in the media or anywhere else. And the aspect of our platforms being powerful, especially now where we're all on our phones or online, is important. It could be life-changing to share a resource for the community, especially right now in this moment. So it's really about being able to hit home for one person that could truly change someone's life. Hearing someone else speak to you about maybe an experience that might be similar to what you're currently trying to figure out, whether it's your identity or just your background with your family, just hearing somebody speak to it is really powerful. So I commend everyone for sharing their experience and for truly being brave, because we're at our bravest when we speak up and take that initiative.
If I could just add something really quick, we've mentioned social media and everything like that. I just want to put it out there that, while it might seem intimidating, creating an account or kind of instead of cold calling, cold following people that you don't know, reaching out to these student organizations or these other students, whether you realize it or not, most of the time people are really receptive of what you have to say, and are really thankful that you're reaching out and asking, what can I do to help you? So it's not weird. It's not, odd that you're reaching out. It's really important that you're reaching out and you're making people feel comfortable. And it's really helpful, even though, it might be uncomfortable in the beginning.
Yeah, I would go back to something that you said, Juan. I think, there's a lot of young people who are watching and who will watch this, but there's a lot of folks who are not under 25 or 30 who are watching this or who care about or work with young people. We both either alluded to or mentioned tokenism, and this idea that, this emergence of youth voice being important, kind of adding a young person in here or there. What does it look like for somebody to be a real ally to the major youth advocacy movements that have been going on and that are continuing to emerge?
I think the true allyship is indeed just being accountable and not just using a youth voice once and then being like, okay, I'll check that off my list, let me move on. I feel like it's truly being intentional, listening to the needs and what they are saying that they would like to see, and try and do that, do that change if it applies, if you have the capacity to do that change. And if not, join them in advocating for it. I feel like that's really like being intentional and trying to become part of a movement or to truly support the youth.
I agree with Juan. I would also say that it really looks like using your power to elevate the student voice. I will always be so grateful to a professor that I had who really liked what I was doing, and she used her relationship with the president of the university to get me a meeting to speak to him about my initiative. And so really just using the authority and the power that you have to amplify what students have to say and putting them in those positions of authority and getting them in the room where it happens, per se.
Definitely. And kind of just to go off of your point, Kelly, how, there's other folks here that aren't necessarily college students or they're a little bit older. Definitely don't discredit, mutual aid efforts. I think, during this pandemic, mutual aid efforts have been life-saving when we're talking about like community fridges or just any virtual space where communities can come together. Definitely finding that and, finding power within that, sometimes those that are empowered just simply will not listen to you. And it's definitely a frustrating thing, but that does not mean that we have to suffer in silence. There's power in community and, speaking up and organizing within a shared safe space can be very transformative.
Thanks, Marissa. So just wanted to go right before we wrap up, wanted to go around rapid fire we talked about what you would say to an ally or somebody who works with young people, but before we close, what is a quick message that you would give to a young person out there who says, I have a mental health story and I want to do something? What would a quick message that you would have for them be? And I'll start again with Juan, and we can go in the same order.
Yeah, I definitely say just you're the expert of your own experience. It's not wrong for you to share, and you could truly help save someone's life, and it really will help you grow as well. Oftentimes people might be scared of speaking up or seeking resources, but by doing so, you're helping yourself and others. And I would also encourage them to continue their journey and by having a vision and passion, and to do it when they're ready for it. Don't feel the need to jump right into it. There's no perfect timing for it. There's no perfect way to do advocacy, but just the fact that you are considering and willing to share your story at a certain point in your life is truly transformational. We oftentimes say that the mental health system can't be a one-size-fits-all, and the only way we ensure that happens is by having different perspectives in the system.
Nanya.
Yeah, I agree with everything that Juana said, especially the part about your experiencing being so valid. And I know that it can be really, really daunting sometimes to get involved in the space, especially if you're not sure like what other people have been going through, what kinds of things there are. I would say don't forget about just starting with your local community first, starting with the people around you, whether that's your friends, your peers, your family, bringing up this conversation at the dinner table, wherever you can, to sort of promote more dialogue around mental health. I know that's especially hard, especially when you're in a community that it's especially stigmatized in, like different cultural communities, school communities, but you'd be surprised how much impact you can make just by the people around you, and just sort of starting small. And then I think the other thing that I would say is know yourself. It can be really easy, especially as a mental health advocate, to lose sight of your own needs and if you need to take a break because you're so focused on supporting other people. But definitely don't be afraid to step back. Don't be afraid to take time for yourself, because you can only help others if you help yourself first. And burnout is very real and not talked about enough. So yeah.
Thanks, Sonia.
I definitely, sorry.
Go ahead.
I definitely agree with that. And then, you know, like I had mentioned before, I feel like I keep reiterating myself, but it's okay to start small, and it's okay to, recognize that maybe you're not ready. I know for me, it took me a very long time to learn how to ask for help. Healing and empowering yourself takes time, and just know that that's okay. It's okay to take things slow. I think, in this age of social media, we see so much that seems to happen overnight, but really what folks don't see is all the work that you're doing outside of that, before you present yourself on whatever platform. There's a lot of work behind the scenes that we don't see, and just know that it's not going to happen overnight, and that's completely okay. If it does, great, but if not, it's okay. And, there's definitely other steps that you can do beforehand that are definitely important.
Go ahead, Joy.
Yeah, I really just want to touch on like what Marissa said and about asking for help. Be an advocate for yourself first. Learn how to do that, because when I was a freshman, I didn't even know what the ADA was. I didn't know what student disability services was, but once I started seeking resources for myself, I could tell other people, hey, this thing exists, especially departments or services that have very low visibility. And also, like everyone has said, don't be afraid to start small. The idea of starting a movement can be so daunting, but don't let that fear paralyze you. My first act of advocacy was giving a presentation in a gen ed class about mental health stigma. It wasn't a class about mental health. It was just give a presentation on anything. And I started with, hi, my name is Joy, I have depression. Just something as simple as that. And someone coming up to me after the class who I didn't know and said, hey, like, I really appreciate your presentation. Your story and your experience is so powerful, and you don't have to write a book or make a long, super artsy social media post to get people's attention. Just start a conversation. Just speak your truth.
I couldn't agree more with what all of you guys are saying. I would say for me, knowing when to and how to ask for help, kind of going off of what everyone else has already said, but knowing that people care about you, and you should ask for help if you feel like you're struggling. And then going off of that, kind of as you build your own support system, that's a form of networking to begin with. And that network that you form when, you speak with others and explain your story, that becomes really important when you try and build your initiative or whatever you're trying to go on to build, as an advocate. So really just, communicating with people, I think for me, in my experience, has been the most important thing, not hiding my story, not, pretending that everything's okay. When you feel comfortable, really just getting out there and being vulnerable, and then just using those connections that you've made to, help others, inspire others, build your own platform that you want to make. That has been really transformative for me.
Awesome.
And
Thank
if you're
you.
having these, if you're having these, thoughts of what can I do? I want to do something. I would say, do it, because, you're going to regret it if you don't. So definitely do it, get involved. And I'm sure all of us here would be more than happy to help you with that.
Thanks, Brayden. Thanks, everybody, for sharing your awesome work and experience. And I'm running us over, so I apologize. Thanks to everyone for listening. We will take a quick break, and then we will be back soon with NBA player and mental health advocate Kevin Luff. Don't go far.
What an incredible 2 days this has been. This year's brought so much uncertainty, unrest, and anxiety along with it. And we know that the conversations we've had over the last 2 days need to continue. At MHA, we're committed to continuing this work. As students and teachers return to school in such uncertain times, we will continue to offer them our unique resources to help ease their mental health burdens. And we'll continue to call on policymakers to make school children a priority, to fund mental health resources and education for all students, teachers, staff, and parents, and to fully fund the special education mandate that entitles every student, including the tens of thousands with early stage mental illnesses, to the individualized services they need to succeed academically. The pandemic is not an excuse not to do this. These are essential parts of public and private education. And as employers and workers continue to adjust to more remote work than ever before, and as all forward-thinking employers work to hone in on building productivity by supporting the mental health needs of their employees, we're going to be right there with you. Honoring those who step up with our Bell Seal for workplace mental health, and providing guidance, support, and connections to resources to those who want to step up and ask for our help. To the broad community of those aiming for mental health and wanting to mitigate the effects of mental illnesses, we will continue to address your needs. All you need to do is ask. We will continue to offer our free online mental health screenings at mhascreening.org, which is by far the largest and most comprehensive real-time mental health screening program in the world. We have called attention to the hundreds of thousands of people who are newly affected by anxiety, depression, psychosis, and other conditions since the beginning of the pandemic, and the tens of thousands who think regularly of suicide or self-harm, and to literally millions more. If you or your loved ones are among them, know this: we and our MHA affiliates around the country are here for you. We will do all we can for you. We will offer you resources, information, peer engagement, and tools you can use by yourself or with others to monitor and improve your mental health. And we will work non-judgmentally with you as you decide what help to seek and when to seek it. It's all there at mhascreening.org and our S2S Screening to Supports post-screening environment. All it takes is a tap on your tablet or phone or a click of your mouse to give you some hope. And to push policy forward, we will continue to report out just the aggregated data of what we're seeing from our nearly 6 million screeners to date. This is helping us quantify the impact of mental health concerns on every population and subpopulation. The mental health impacts of the pandemic specifically, especially among young people aged 11 to 24, who are feeling these effects most deeply, and the information we need to advocate for changing the present systems of care, services, and supports that have primarily been responsive to the needs of the few at the expense of all others. This should go without saying, but it can't. We have suffered for centuries from a segregated mental health system. Every other condition got care in the regular health system, informed by public health. And we were segregated into primarily a state-run mental health system informed by public safety. Many of you have heard me say this many times before. By applying a non-clinical danger to self or other standard as a trigger to treatment, we made mental illnesses the only chronic diseases in America that we wait until stage 4 to treat, and then often only through incarceration. We have called this stigmatizing, discriminatory, inhumane, as it has ripped apart families, undermined our sense of community, and cast allies as adversaries, as we have tried repeatedly to change this for more than a century. And what has crystallized in the past few months, perhaps as a result of the enormous stress we have experienced as a result of the pandemic, and perhaps coupled with generations of trauma to which many people have been subjected, it doesn't really matter, is that we haven't just done this as a matter of policy to people with mental health conditions. We have done this as a matter of policy to Black people, brown people, all people of color, biracial immigrants, people whose first language was a language foreign to us. And by doing this, we have undermined the mental health of our nation so that today, according to the CDC, a quarter of the nation is thinking about suicide. And today, according to the US Census Bureau, a third of the nation is experiencing anxiety and depression. Our founder, Clifford Beer, said that we must fight in the open. It is incumbent on us to say some things in the open, to build bridges that will enable us to take this fight successfully to the ballot box this fall, into the 2021 Congress, and into the next 4 years of what we all must work together to assure will be a more enlightened administration around mental health. The first is that race matters. It always has. Ending racism is a mental health imperative. The second is that MHA is committed to anti-racism in all that we do. This means that we pledge to work against individual racism, interpersonal racism, and institutional racism in all forms. The third is that ultimately it is about policy. We will not forget that racist policies lead to racist ideas. Discriminatory policies lead to segregation in practice. And the solutions involve changing policies together if we ever want to successfully change practices and ideas. Black lives matter. When we talk about mental health, don't all lives matter, some have asked us? Of course they do. That's why Black lives matter. It's simple. It is because a young Black man with a mental health issue is going to be treated differently from a young white man. A Black woman differently from a white woman. They have always been in our part of the world since 1619. A Black man will be expelled from school more frequently, incarcerated more often, homeless more commonly, unemployed more quickly, the target of police violence more likely, and left behind more simply. I don't just believe this. In my family, as in millions of others, we have experienced this. At MHA, we will keep talking about these things. We will also act to create lasting change. We will stand with others who are raising their voices and acting to ensure equity across systems. We will continue to be part of protecting human services, the right to assemble, to protest injustice, and to fight racism and to end it once and for all. The reason for all of this is also simple. What all of us need more than anything else, all of us these days, is hope. Hope that the pandemic will abate. Hope that, like Senators Cassidy and Kaine, our leaders will lead, caring more about us than about themselves. Hope that our lives will get back to normal soon, or at least that everyone will find more comfort and joy and experience less trauma and stress as we move forward. Hope that we will become one people someday, all truly treated equally. Hope breeds resilience, and resiliency is the ticket to recovery. And that's why, if you've enjoyed the programming of the last 2 days and you want to keep talking about these issues with us and working on these issues with us, you will not want to miss next year's annual conference, scheduled for June 10th to 12th, 2021 in Washington, D.C., with the theme, From Resiliency to Recovery. We certainly hope that by then we will be able to gather together safely in person. You can sign up for updates on the event and all of MHA's programs at mhanational.org. Thank you to all of the sponsors, and thank you to all of the speakers that joined us during this week. And thank you to all of you for tuning in. Be well, take care, and stay safe.